of panel session once our members arrive. I hope all the participants had a glimpse of our tribal village, which is very unique with exuberant display of the articles, handmade specially. हे खाली ठेवा. इथं ठेवता? इथं ठेवा ना, इथं. माईक बंद करून येतो मी अगोदर. नाही, ठेवून द्या. I would again I would once again request all the delegates to kindly scan the QR code displayed on the ID cards. A very good afternoon to one and all. I welcome you for the post-lunch exciting session, and I am equally excited to quick start the session with the most igniting panel discussion where brilliant minds assemble in a stimulating quest for wisdom under the theme Tribal Health Policies in India. For this, please help me invite the moderators for the session, Mr. Ravindra Thakre, IAS, Additional Tribal Commissioner, Government of Maharashtra, and Dr. Yogesh Jain, ex-faculty, All India Institute of Medical Sciences, Delhi, who is presently working in a rural area of Chhattisgarh since last 25 years. Please give them a big round of applause and show our excitement for the upcoming panel discussion. Welcome, sir. With the permission of our moderators, I would like to invite the panelists. Ms. Reena Kangale, IAS, Chief Election Officer, Chhattisgarh, Raipur, India. Please help me welcome Ms. Reena Kangale, IAS, Dr. Praveen Gedam, IAS, Divisional Commissioner, Nasik, India, Ms. Naina Gunde, IAS, Tribal Commissioner, Nashik, India, and Dr. C.B. Pradesh, National Officer, Tribal Health, World Health Organization, New Delhi, India. I welcome all the panelists up on the stage. Welcome all. Now I would request our moderators for the session who would be taking up the charge for the next 60 minutes. So I request Mr. Ravindra Thakre and Dr. Yogesh Jain, sir, to please take over. The panel is all yours.
Good evening, all of you. Actually, we will begin with something slightly a different approach for this particular panel discussion. I'd like to tell you that the city where we are actually presently having this particular function and event, it was established by a tribal king, Bakht Buland Shah, in 1702 AD. So the Gond tribe, which is a major tribe in this region, Central and South Asia, South India, this particular tribe had a good political control. They were the ruling clan in this particular region for a considerable historic times. I could also tell that this particular tribe has a very rich cultural heritage. They have the system of Gotul, which used to be what we could call it as a university at that point of time. And in this particular Gotul, the new youngsters were educated regarding the medicine, they were educated regarding the dance, the folk arts, and all these things were imparted over there. This particular Gotul system also actually took them to very different heights, and this tribe had a very what we could now find in modern world, the equality amongst the gender was very much over there. The uh, there was this tribe also practiced exogamy, and which was a very thing of science at that point of time. So I personally feel we are actually introducing, but this particular tribe and the other tribals also in India, they have been, they actually resided into the forest or adjoining to the forest areas, which were hilly regions or remote regions, and cut off from the main part of the country. And therefore, when the modern, with the advent of independence of India, the tribal regions could not really progress to that extent as the other communities have really flourished and progressed. But then we now have a very different scenario coming up. The government is has launched two big projects. One is PM Janman, and the other is Dharti Aba Janjatiya Utkarsha Gram Abhiyan. So with these two initiatives of the government of India, we will be seeing a very sea change into the tribal lives. We will also we can see that with the National Health Mission, with a lot of various schemes and programs that were launched. So we could see with those programs, we had all the parameters, indicators, whatever indicators we have been able to find out. The indicators batana jara. If we see the health indicators, उसमें the infant mortality rate is still higher for scheduled tribe than for the under 5 mortality rate is still higher. So all the rates or all the indicators, health indicators, if we observe, they are on above the average of the Indian averages. We could also find that the sex ratio, but the another thing is that sex ratio amongst the tribes is better than the average Indians that we have over here. But the literacy rate is also is now uh, has come up in a very good manner. So on one hand, we have uh, this particular scenario of indicators, and the other one, we are having the schemes of the government regarding the national health policy, wherein the government is trying its best to really address the issues faced by the tribals. With the national health mission that we have and the Ayushman Bharat that we just listened from Dr. Indu Bhushan sir, an effort is being really made to improve the health facilities that are being given to the tribals. And these are some of the factors that we are able to see over here. The relaxation of population norms has been done for the tribal areas. We have mobile medical units in a more number in tribal areas. Then uh, we have the minimization of out-of-pocket expenditures for them with the rollout of free diagnostic and free medicines. The ASHA workers, we have the norm of 1,000 per 1,000 population. That has been also relaxed for tribal areas. National ambulance services are there, which gives a free transportation to the tribals for accessing the health facilities. We have high priority districts on the composite health indices, which will be getting more funds from the NHM National Health Mission funds, and incentivizing and giving better honorariums to the doctors for obstetric care and C-section LCS trained doctors also. So an effort, a good effort has been made from the government side. But in spite of this, we find that the indicators are not still matching with those of the average Indian indicators. And therefore, we have to still make certain more efforts. And we'll just try to find out through the panel discussion today that what could be the ways and means by which this particular gap could be bridged. So I'll just request Dr. Reena Kangale to elaborate regarding the tribal health policies that have been implemented in Chhattisgarh regarding the women and child and the implementation gaps that you could find over there.
Thank you very much, Ravindraji. Uh, I come from Chhattisgarh. I'm a senior administrative official over there, and I have spent, this is the 20th year of my service. Chhattisgarh, as we all know, has a tribal dominant state with more than 30% of the population being tribes. Especially, we are at a very, I feel, developmental paradox. India has in the last decade almost doubled its GDP. But if you see our important health indicators in the UN Human Development Index, India ranks at 134 amongst the 193 countries. So important health indicators, especially the nutritional status of women and of children, is abysmal. Every third child is stunted. Every fifth child, these are all parameters of nutritional status. One is stunting, one is wasting, one is underweight, that is weight at birth. So India, the rate of malnutrition, stunting is, as per the NFHS 5, it is 35.5%. And as far as low birth weight is concerned, it is around 32%. As far as low wasting is concerned, it is almost 20%. So by that measure, I'm saying that every third child is stunted and underweight at birth, and every fifth child is low birth weight. If we take this measure and we look at tribal population in India, roughly 10 crore of them, we find that this nutritional disparity is even more grave. And every second child is stunted and underweight. Every second child. So, where 30% of children go hungry to bed, it is really a matter of grave concern for everybody, all policymakers and developmental analysts, to see why a country which is growing at the fastest rate should have such a situation. The National Nutrition Mission, or the Poshan Abhiyan, as it is known, the Prime Minister's overarching scheme for nutrition, was launched in the year 2018. And the objective was to eliminate birth weight by the year 2022 with 2% every year was the target. We are very far away from the target, have not been able to achieve them. One of the major reasons, I believe, if I can just give you an example of policy implementation and policy gaps, through my experience, because I've worked in Chhattisgarh and I have worked there for a long time. The entire nutrition infrastructure and government setup, the ICDS scheme was started in the year 1975, and it is rolled out. The nutritional services are rolled out through the Anganwadis, and an Anganwadi ideally caters to a population of around 1,000. So if we see the ratio of one health worker catering to a population of 1,000, having around 50 to 55 children in one Anganwadi. Uh, in the year 2013-14, when the NFHS 3 was carried out in Chhattisgarh, the malnutrition percentage were in the figures of 50-52%. It was huge. So every other child was malnourished. At that point in time, we had the ICDS scheme. And in fact, the Ministry of Women and Child Development that we hear about is also very recently, it wasn't there in the year, it just came and it was established in 1990. And the scheme ICDS was handed over to it. The Anganwadi centers, basically the Anganwadi worker and her Sahika is overloaded with work. I take care of elections. I also in last 2 years conducted elections, and majority of the election work, the census related work, was also carried out by her and her assistants. So in 2013, considering the genesis of this, let me also tell you that public health expenditure budgeting in India is only 1.9% of total GDP. So the schemes that are rolled out are basically very, very thinly distributed across the board. So if you want to open up, there is a demand establishing new Anganwadi centers, but the cost of setting up a new Anganwadi center and recruiting new Anganwadi workers is huge burden on the government. Given such a scenario, we will have to come up with solutions, especially when state governments look at, cannot be looking only at budgetary outlays, cannot be looking at a centralized one solution fits all kind of a answer to this huge problem of nutritional deficit. The solution will lie in a community-led, community-driven solution. And I just like to elaborate here a small example and success story in Chhattisgarh, what are known as Fulwaris. In 2013, the Chhattisgarh government launched what was known as Fulwaris, which were basically community or habitation-based creche or daycare centers. So Anganwadi was set up for over 1,000 population. The objective of Fulwari was it was set up for 10 children. So the ratio of a caretaker to a, child was only 1:10. Many such Fulwaris were set up, and the objective was basically targeting under 3 children. What we today have in the Anganwadi centers is that they cover from, the coverage is 0 to 6 years, but children who turn up, come in the Anganwadis are age 3 to 6. So for what about under 3 children? Because where does malnourishment strike? It strikes early in the, and you'll find that SAM and MAM children are usually those who are under 3. The highest rate of SAM children is under 3. Almost 52%, 50% comprise of them. So for these children between the age group of 0 to 3, a daycare center set up at habitation level, run by mothers on a duty roster system. So within the neighborhood itself, 2 mothers would come up and they would take the charge of cooking meals. We would give them eggs 3 days in a week. This is apart from what the government template for, or the universal template was for children. In 10 years, in NFHS 6 today, our nutritional status is much better. 29 percentage points drop. We stand at 31% today from a 52%. It's a huge, and it was a totally community-led program. Today, Fulwari is known as the Mukhyamantri Suposhan Abhiyan. It has a different name, but the format remains the same. We have got Poshan Kendras. They have been decentralized to the level where we can directly cater to 10 children and not more than 10.
No, I get it. You know, the if I may tell you, Dr. Kangale, the Phulwari program was what we had started in an NGO. It was taken up by the Sarguja collector then, and then took on to the entire state, only in the tribal areas, not in the rest of the state. And but you know, I have a bounce back question for you when you're talking about child nutrition in the context of overall tribal development. Um, and that's also a question to our colleagues in Maharashtra. Um, I learned a couple of days ago that the Maharashtra government has withdrawn provision of eggs in its WCD program. Um, uh, Provision of eggs. Eggs is something the best protein that there is in any food. Whether you count meat, milk, eggs, and the pulses and the nuts and oil seeds, the best protein is and the most economical protein is of for eggs. And I learned that Maharashtra has also stopped it 2 days ago. I know many other states are not giving it. Chhattisgarh gives it in a very measly manner, one egg into undernourished, severely undernourished children once a week. How do we, in this context, look at this? You know, in a sense, this sort of I would say a regressive tendency.
If I respond, actually, the dietary recommendation for eggs is more for SAM and MAM children, and basically children at least 3 times in a week. The assistance for something like that, because the cost of one egg is almost 6 rupees, I believe by now, 7 rupees. So it is a cost burden. It requires a substantive budgeting, and that budget availability can be made if it is a top priority with the government. And definitely it is with the government of Chhattisgarh, the Mukhyamantri Suposhan Abhiyan was precisely launched to cover these gaps that Poshan Abhiyan cannot.
At the moment, we are not giving more than one egg in a week.
Okay. Uh, yeah, see, we do have these budgetary constraints, and the government has to really look after so many domains. But still, as rightly pointed out, it has to be paid more attention. That is the story, moral of the story over here. I'll just request, because we have seen that the infrastructure also plays a vital role in the tribal health, and there is always a cry regarding that the, there is lack of some access or lack of infrastructure is there. So I'll just request Dr. Praveen Gedam to kindly throw some light on this particular aspect and also narrate his experience regarding Nandurbar, which is also tribal district in Maharashtra.
So I think so. Thanks first to the organizers and thanks Mr. Thackeray for that question. I have worked as a medical officer in some remote PSC in this very same district of Nagpur, and then spent 5 years in the center, and I was in the Ministry of Health for 3 years. And now, significant part of tribal area in Maharashtra comes under my jurisdiction, Nandurbar being one of the major tribal districts of the state. So when it comes to issue of access, there are multiple factors. Maybe I can classify them in different points. The very important factor is lack of availability of adequate human resources. So things are improving, but still posting to a tribal area, Gadchiroli or Nandurbar, it is often, and as was said by Honorable Minister Gadkari Sahib also, it's often seen as a kind of punishment, etc. So that's one major problem that we face. Again, they have very peculiar topography. Like in Nandurbar, if you see, there are like padas or habitations spread over. So the same, say, Anganwadi worker or Asha or MPW, he has to travel a lot of distance. You can see one photo here. They have to travel a lot to cover the same population. So that's another issue. The other issue is about health infrastructure. The number of hospitals, medical colleges, now that they are coming up in all the districts, but that's a major issue. We already are one of the lowest in the world with kind of 1.3 or 1.5 beds per 1,000 population, way below global standards, and these areas are even worse. So that kind of accentuates this problem. The other issue is of this. So this is the photograph of Nandurbar district, one random habitation, and the whole topography of that area, those 2 million people, 20 lakh, 21 lakh people, they live in places like this. And the distances are also huge. The district headquarter Nandurbar is 250 kilometers from nearby big cities like Nasik or Surat. But then these are even beyond that, 100 kilometers beyond that. No good roads. So I remember after joining at Nasik, one of the news which came was titled as Bambulance. I have that photo if somebody can. So this is how health workers reach at various places. Go to the next, and yes. So she is a pregnant lady about to have a delivery, and they don't have an internet connectivity there. That's another problem. So they cannot call anybody. So they just take that lady. This is in the middle of monsoon, to a place where they can go and get some kind of vehicle to go to the nearest health unit. So this is a very difficult problem, I will say, to solve, because obviously lack of resources, and the way these are spent, the planning is done. We are trying to do something about it. And another issue about tribal areas is lack of finances. I mean, India was spending almost two-thirds out of pocket for expenditure uh, from their own pocket, and the current figures I think are slightly less than 10% after Ayushman Bharat came in. So even now we are spending almost 50% of expenditure out of pocket, and these are the poor people. They don't have hospitals nearby, HR nearby. The nearest hospitals are far away, and they don't have money. So it's a problem from all the sides, kind of crushing. And then to top up, how the health conditions arise on the first instance is a social determinants of health. And they, so it's a very, so health, you all know, is a very health indicators, they are a kind of outcome of a very complex interplay of everything that is happening in life. How is the water quality, how is sanitation, how is the quality of nutrition, education, the livelihood opportunities, and everything tribal areas lack compared to rest of the country. So I think it's not a small problem, obviously, and it has to be tackled by tackling all these dimensions that I just discussed. And I understand that whatever is being done is not sufficient. Government is trying to do it, civic societies, NGOs are trying to do something, but maybe we need to accelerate in that direction.
Yes, what you say is right over here because the terrain itself is so hostile that it's really difficult for any human being to come to cover all those areas and really give good services. And the finances, as you really pointed out, will be an great constraint again, as we are all the while speaking about it. I'll also request the other panelists over here, uh, Srimati Gunda ma'am, regarding the children who are in the schools, in the government ashram schools. What is the health policy regarding them and how it is being implemented?
Good afternoon, everybody. First of all, let me thank the organizers for calling me for this August gathering. As Tribal Commissioner, um, the Tribal Department is responsible for providing quality education to the tribal children. And along with education, their other needs are also be looked after. And health is one of the major parameters. And when I talk about health, it's not just the physical health, it's also the mental health, the psychological health, and the emotional health as per the guidelines of the new education policy. So the holistic development of the students is the responsibility of the tribal department, and the tribal department is the guardian of the children of the students who come to these schools. Let me give you an idea of the number of institutes that the tribal department is running. We have 499 ashram schools. Ashram schools are residential schools from 1st till 12th standard. And these 499 institutes are run directly by the tribal department. Then there are 553 institutions, schools, which are run by NGOs and societies, but under the aegis of the tribal department. Then we have 37 Eklavya model residential schools. These are also residential schools, but they are CBSE guided. They are English medium schools, and the children who come here, they come through a competitive exam, which is conducted when they are in 5th standard. And the education is through English medium CBSE. And also for higher education, the department has made provision for 497 hostels all over Maharashtra. So these are the institutions which are run by the tribal department, and in these institutions, there are more than 6 lakh students who are studying here. So I would like to tell you the kind of initiatives that the department has taken to provide good health to the children. Uh, First of all, providing good living conditions is most important. So taking this into consideration, since 2017, there is a separate PWD wing, Public Works Department wing, for especially for tribal areas, and which is headed by a chief engineer, 2 superintendent engineers, and 4 executive engineers. And they look after exclusively after the tribal schools, tribal hostels. And the buildings that are coming up, I can confidently say that 85 to 90% of our buildings are very good. They are built as per a type plan. There is a separate school building, separate girls' hostel, separate boys' hostel, and staff quarters. So the living condition are improving, and hopefully the PWD wing has made a program by which in the next 3 to 5 years, our 100% buildings are going to be as per the type plan provided by the state PWD department. Regarding nutrition, uh, nutrition, as we have been hearing, is a very important part of a child. So since 2015, an effort has been made, a conscious effort has been made to provide good nutrition to the students. And the initiative for this was started in 2015 with the help of Akshay Patra Foundation and Tata Trusts. Most of the people here might be aware of the Akshay Patra Foundation, which works for ISKCON, providing meals in thousands of numbers. So Akshay Patra Foundation and Tata Trust Together, they established 5 central kitchens. Uh, and in one central kitchen, the food for more than 10,000 students is prepared. And the initial 5-year period, the central kitchen was operated by Tata Trust and Akshay Patra, and then gradually it is being taken over by the department. The food here is as per a prescribed menu. It should be nutritious, it should be tasty, it should be liked by the children. And even the local needs of the children are taken into consideration. For example, tribal children like to have fish. So provision for fish is also made, non-veg is provided, eggs are provided, bananas are provided, and also as per directive of an High Court PIL, milk is also being provided to the students. So initially plain milk was provided, but it was found that tribal children don't like plain milk. So for the past 3 years, we have started providing them flavored milk in Tetra packs. And this is in 4 flavors. And when we talk to the children, we find that they really like it. The meals are provided 4 times in a day. First is the breakfast, then the lunch. At 4, snacks are provided, and at 7, the dinner is provided. Uh, Seeing the success of the central kitchens, initially we had 5, now we have planned for 5 more central kitchens which cater to more than 10,000 children. And we have also planned for 15 semi-central kitchens which cater to less than 10,000 children. The central kitchen in Nandurbar, it was visited by Amitabh Kant sir, who was then chairman of Niti Aayog, and also then health minister, central health minister Mandviya sir. And it was noted in one of the best practices, which is published by Niti Aayog. Regarding their physical health, uh, we work together with public health department. Public health department is mainly responsible for providing good health to our children. We have taken one initiative. In all our tribal schools, there is a sick room with provision for basic medicines. And now, recently, we have finalized one nurse for each ashram school who will be residing there full time and who will attend to the immediate physical um, injuries or other minor ailments. But where the student has a major ailment, he will be referred to the other institutes. Then public health department under RBSK program, Rashtriya Bal Suraksha Karyakram, they conduct the physical checkups of all the children, and we see to it that it is done regularly. Now under PM Janman, uh, sickle sickle cell screening has started in all our schools, in all the ashram schools as well as the EMRS schools. And up till now, more than 2 lakh children have been screened for sickle cell. Uh, Children who have been found positive, parents, their siblings, they have also been screened. And in Nasik, a special project called Nasikal is taking place with the guidance of Kanetkar madam, and funds being provided under nucleus budget from Nasik PO office. One thing I would like to mention to you all is that we have the department has provided sanitary pads to all the girl students. And in a survey which was conducted by UNDP, it was found that 100% girls are now using sanitary pads. And not only in the school, but even when they go home, in their holidays also, they are using this. So I think this is a very good behavioral change that has come because of the initiative taken by the tribal department. Along with their physical health, their mental and emotional health is also very important. And especially children who are studying in 10th and 12th standard. They face exam pressures. Then also sometimes there may be family pressures or peer pressures. So sometimes students take some extreme step. So to prevent this, last year, tribal department took an initiative, and we have an MOU with NIMHANS, Bangalore. This is National Institute for Mental Health and Neurosciences. So the NIMHANS team, it toured extensively. It talked in Maharashtra. They talked to the children, they talked to the superintendents of the hostels, they talked to the teachers, and then they came up with a special program for mental health of the students who are staying in our hostels. So they prepared a 7 module program, and the trainings are going on. They have trained our superintendents on how to recognize stress among children, to create awareness among them, provide life skills for them. In fact, last week in Public Health Institute in Nagpur, there was a team from NIMHANS, 7-member team, which came, and there was a training program for our superintendents. So we are working along with them to provide good mental health for our children. Also, to make them aware of their rights, the department is also empaneling 10 NGOs who are working in the field of child rights. And these NGOs will be allotted schools, and they will be working with the students, and they will form committees. Then they will create awareness about child rights, about life skills. So 10 NGOs will be empaneled, and to create awareness among the, not only among the children, they will also have workshops for the parents of the children, and also the village level. In most of our schools, in all our schools, we have the Vishakha committees also. We have a grievance redressal system also. Also, we have a toll-free number where any child or any tribal person also can uh, call anytime regarding his problems. So these are some of the initiatives that the department has been taking. And we also take into consideration what the children want, and make policies according to them, make changes according to them. Thank you.
Yes. Uh, I will now go to our fourth panelist, Dr. Pradesh. He is working with WHO, and actually is a liaising with MOTA, that is the Ministry of Tribal Affairs. So I will just request him. He has been a part of a very prestigious committee on health policy, Dr. Abhay Bang Committee. So I just request him to narrate his what are the recommendations of that particular committee, and what is the present status of it. So,
Thank you so much, sir. Let me just correct you, sir. I was not a part of the Abhay committee. Uh,
my apologies for that.
it's all right, sir. So let me start saying this, that we, for the past 2 days, we have been listening to a lot of models throughout the country. But as of now, any of the states in the country or the country doesn't have a tribal health policy. So the need of the hour, can I have the next slide? The need of the hour, as I understood, the personal views that I'm going to say, the need of the hour, as I understood, is a tribal health policy that is based on the report or the report of the expert committee on the tribal health in India. I hope all those who work in tribal health has read this report at least once, because this could be considered as the Gita for the tribal health in the country, the roadmap for the tribal health in the country. There are some excerpts which I have taken from this expert committee report, which I feel is what I would like to call the tribal lens, wherein we are looking at tribal population or the Adivasis through a general lens. So when we talk about, replicating model that has been successful in one tribal area, every day. The problem lies with the fact that the tribal people are in not a home. There is a huge variation in the history, lifestyle, in the culture, in the health situation, the beliefs. So there is huge variation in this. The second exception the expert committee made was that there should be a tribal health cell in each state and a tribal health nodal person who will be responsible for defining or describing how the tribal health activities in the state should be done. The committee report also says that uh, there should be cells in the district level and even at the block level for the management of the activities. Again, coming back to the tribal lens, we have been hearing a lot of things for the past 2 days, and I was really worried that the tribal community in the country is suffering so much. But let me tell you, the tribal community in the country is not suffering as we think. Of course, the indicators are so many indicators are not that good as we compare to the general population. But look at the sex ratio. The sex ratio is far better than our general population. Look at the immunization status. The immunization is far better than what the general population, have. There are no orphans in the tribal communities. Even if the father and mother dies, some other family will adopt the child. Majority of these communities has their women empowered than that of the general population. So let me tell you again, the tribal communities are not suffering as you think. But obviously, the other health indicators are needs improvement. They need improvement. So, but then why over the it has been 76 years that we got independence, and why we are still struggling to provide such healthcare to the tribal community so that these health indicators come up. The problem is that we fail to understand the concept of health for the tribal people. There are multiple domains for it: spiritual, environmental, cultural, social, physical, and mental. It's a holistic concept. That is a balance of spirituality, traditional medicine, mark that word, traditional medicine, biodiversity, and the interconnectedness of all that exists, which we fail to understand. That is why we are still struggling to provide them a better healthcare that is acceptable to them. The challenges that we are facing, what are the challenges that we face in delivering these health services? Again, coming back to the expert committee report, this is a passage from that committee report in which the search Gadchiroli model was mentioned. They had done a discussion with the tribal people and the tribal heads in that area, and what they found out that the problems or the hesitancy for them to visit the visit the health facilities was the big buildings of hospitals scare us. We feel lost. The hospital stuff ridicules us. They speak some strange language. Here, in this case, English. The doctors and nurses are wrapped in white clothes, which they use for covering their dead bodies. The sick patients are admitted, but the relatives are thrown out. Medicines are very costly. And finally, there are no God in the hospitals. How can there be healing without God? These were the questions that were raised, and the government model was, as per the book, based on those models. Next, please. So basically, the challenges faced are issue of availability, accessibility, lack of accessibility due to discrimination, physical accessibility, economical accessibility, and the failure to take learned decisions because there is information accessibility issues also. Then there are the cultural and belief-based acceptability issues. Since it's the last mile that we about, there is quality issues also. The quality gets compromised once the services reach the last mile. So how can what I would suggest is the decentralization of the policies, the decentralization of the activities, and the first step towards that will be a straight tribal health policy. Like Yogesh sir says, not specifically towards the tribal people, but towards all the people in an area where the tribal people are settling. Maybe a block like that. Next, please. So before going to that, I'll take 5 more minutes. There is a United Nations. Please go back. Oh, okay, sorry. Can I just back? Yeah. There is a United Nations Declaration on the Rights of Indigenous Peoples. It says that it is a 36, there are 36 articles in the UNDRIP which says about the rights of the tribal people. I'm just talking about the Article 24 of this document, which says, please listen to this carefully. Indigenous people have the right to their traditional medicines and to maintain health practices, including the conservation of their vital medicinal plants, animals, and minerals. They also have the right to access without any discrimination to all social and health services. Let's skip the second point because that is common to all. Indian government has decided that all the people in the country are indigenous, and so this is applicable to the entire country. That includes tribal people also. So this is applicable to tribal people also. Next, please. So based on these thoughts, if a state policy is to be developed, it should be based on justice and responsibility. The concepts of justice, rights, and equity should be maintained. It should be appropriate to the cultural beliefs. It should be autonomous in such a way that the health system should be for the tribal people and run by the tribal people. And the healthcare providers should realize that we are the technical experts to support them, nothing more. Nothing less, nothing more. Please, next. Uh, Next, please. There should be a decentralized planning and administration structure. There should be universality also because the tribal peoples are not only settled in the tribal hamlets. They have migrated towards the urban areas where there is more job. And this calls for an action where all the health institutions in the state are tribal friendly. Next, please. So this we have already covered. Next. So how does the state tribal health policy, state tribal health policy should address these gaps? It should define the organizational structure at the state and the district level. There should be provision to develop tribal specific data capturing mechanism. I'm sorry to say, currently we don't have, except for research studies and based on data on research studies, we don't have data on the tribal health data currently. There should be measures to engage tribal healers as equals, not as health delivery points, but as equals. Measures to engage the tribal heads and mundas, tribal leaders, and tribal communities themselves for the behavior change communication. There should be measures for doorstep delivery of health services, including mobile medical drones, teleconsultations. There should be steps to improve the soft skills of the health staff. This is an important point. When we were engaging the private sector in tuberculosis, what we identified was that I was then a part of the government system, so I could say this courageously because then I was a part of the health system. The problem not with the private sector but with the government system because we were not ready to give the hands to shake hand with the private sector. The same applies to the tribal population also. The skills of our health service providers should be improved in such a way that they address the tribal people with the sense of equality, with the sense of respect, and with the sense of love and empathy. There should be ideas to address the out of pocket expenditure, which is already there. There should be identification of the non-communicable and communicable diseases to the area and measures to counteract them and to address the determinants of the health in the tribal areas through the tribal communities themselves. The funding mechanisms, but the most important, I'm sorry to say, but the most important thing is, once more please, the most important thing is intersectoral and intrasectoral collaboration, which we lacks. There should be intra and intersectoral collaboration between the departments, between the tribal welfare department and the Ministry of Health and Family Health departments, between the forest departments, between the animal husbandry departments, Ayush department, NGOs and civil society organizations. Let me conclude by saying this. Let us not make decisions for them. Let them decide what they need. Thank you.
So I have two major comments to make on the presentations we made by the panelists. First is I would like to say that we should very actively refrain from being romantic about ideas, which may sound impractical or not so effective also. But I think my second comment is that I think the devil lies in the details. No, we can say that no, we must do this, we must do that. We are doing this. Overall, we are having these number of children being looked after, these many schools being looked after, these many. This is what we are doing for access, but also, I would hold that to account by asking specific questions. For example, in the tens of thousands of children who are being in the tribal in the ashram schools there are. How can you tell me offhand, off the cuff, how many children are with sickle cell disease are getting regular treatment there in those ashram schools when they're staying there? Or I learned you talking about this Akshay Patra. Akshay Patra is known to provide only vegetarian food. How would they be providing? I would really like to understand when you talked about non-vegetarian food, which is the preferred choice for, and also one of the regular part of the diets of most Adivasis in this country. Uh, was that something that you could get over and get it done? That non-veg food, which include even milk is non-veg. Forget about eggs or fish. Whether there would be none. Third is I would like to ask if you are providing eggs, how many eggs are we providing in a week? If not, if you are providing one egg, is that okay? And when suddenly when it comes to money, then even though otherwise we may be saying that we have money is not an issue, but suddenly when it comes to an egg or an important food item, then suddenly money becomes important and say, oh, we don't have the budgets for this. I would ask these three questions.
Regarding eggs and fruits. In fact,
Uh,
ATC office he can
Actually,
give a better
let
idea
me
of this.
myself answer for this for a simple reason that the eggs are being given on a daily basis. That is the first thing to the students in the ashram schools. That's the first thing. Secondly, because the Akshay Patra was done in the Nashik division, it wasn't done in Nagpur division, so I won't be able to comment upon that regarding the non-veg food that had been given over there. But then, uh, and the first one regarding whether the sickle cell identified or not, they have been 100% identified.
No, that's screening. I'm talking
No,
about treatment with
treatment.
hydroxyurea.
Yeah, that's true. The treatment is being provided regularly to them. The screening is the first part, and the treatment is being given to them on a regular basis. And we have made all our headmasters and the class teachers very sensitized about it, so that there is no gap in their medicines. And the superintendents have been also told, the wardens and the superintendents of the hostels have been also instructed accordingly. And a regular weekly follow-up is being taken about all those things. That is one thing. Regarding the non-veg, I cannot say regarding the Akshay Patra
Yeah, I
issue.
will tell about that. Initially, when the idea was floated, Akshay Patra and Tata Trust, they started with two central kitchens, one in Nasik and another in Jawar, Mundegaon and Kamrog. So initially it was veg, but then the demand from the children came up. So even in Jawar, which was run by Akshay Patra, provision was made for providing of dried fish for the children. And there is another organization called Stri Shakti, which is running central kitchen in Nandurbar, in Ghodegaon, and one more place. So there, the food is provided as per the choice of the children. And as I told before, as per the High Court directive, milk was to be provided so that the children get good nutrition. So initially, when plain milk was provided, most of the children would not drink. But for the last 3 years, we are providing them flavored milk in four flavors, and the children are truly liking it. And there is demand. Whenever we go to visit schools, we ask the children specially, are you ready with the flavors that we are giving?
Uh, Pradesh, actually, I would like to have respond to one of the things. See, when we are actually bringing our tribals from a very serene and very peaceful scenario to the modern hurry uh, activity based lifestyles, whether this transition would be really easy or it will take some more time.
Thank you for that question, sir. I think Yogesh sir is the right one to answer, but let me try to answer this. The transition is a huge challenge, not for us, but for them. Uh, there was a scholar from Kerala, my hometown, who said that the addiction and the mental health issues that the tribal people that is seen in the tribal people is mainly because of the forced transition that we are trying to make on them, that causes agony inside them, which takes them towards alcohol, drugs, cigarettes, and other things. So the solution is not here nor there. The solution should be somewhere in the midway, where we should try to improve the health statistics of the people, the health, the strength, the health of these people, by keeping them wherever they are comfortable at, by making them do whatever they are comfortable to do, and by letting them have what they are comfortable to eat. This is my opinion on this. I would like Yogesh sir also to, sir is also.
One of the policy decisions, as per the new education policy, the children should be taught in their mother tongue. So when a tribal child comes to a school, for him even Marathi is a strange language. He may be speaking some other language in his house. So what initiative department has taken, for first, second, third, fourth standard, the Bal Bharati books which they use in schools. So 12 languages have been chosen, and these books have been translated in their Boli Bhasha. And first and second standard books we have already distributed. Third and fourth standard we will do in the coming years. So we are trying to take their views into consideration. Another thing which I found that many tribal students are aware about NEET exam, JEE exams, and the demand for NEET exam is too much, because they know what problems. Huh. IIT, okay. 7 children have cleared IIT and JEE.
Yeah.
And to provide them NEET education, we have selected 4 schools, and these schools, actually, I visited Telangana state, where they have turned their schools into centers of excellence. So, in one of the presentation in Ministry of Tribal Affairs, their secretary, he showed us the quality of their education, and he said this year 99 children from the tribal schools of excellence, they have been selected for IIT. So I was really taken aback. Is it true? 99 children going to IIT. So I said, I would like to visit your state. He said, fine. So when I visited their states, I really found out the way work is being done there. And I'm proud to say that we are copying. There's no problem, because it is a working model, well-established model, and it is showing good results. So from this year, we will form 4 schools of excellence where NEET and JEE education will be provided to the children.
So I think we are coming to a close of this particular session. I'll just say a few words regarding NGO, Live for Upliftment. It's an NGO, Live for Upliftment. It's an NGO which has put up its stall in this tribal village, and they have till the date. They are all students who are actually giving training to the or preparing the students, tribal students, basically tribal students, for NEET and IIT examinations. For NEET, till the date, as per my information, they have completed nearly 259 students have joined College. Am I right? Yourself, you're from Live for Upliftment? No, तुमच्या मागे. Okay, you want to ask a question. Okay, fine. Please.
Can someone help in passing on the mic? Quickly, volunteers. We shall take a couple of questions soon.
We have people from various Western countries also who have been panel members now, and the various countries have moved on from models that are ashram schools to be able to provide education that is culturally sensitive environment of the community from where they belong, rather than transposing them from their environment to a place which is actually quite alien from them and is also at multiple levels. We are now working towards having a cultural and linguistic sensitivity, which is why you worked on those aspects. So is there anything from Mota that moves towards these aspects? Because these schools have been extremely traumatizing to various indigenous communities all over the world. So I was thinking if you could address that.
It is not basically, as you say, it is not regarding transposing from one cultural and environment to very aligned or very foreign environment over there. See, when why do we have residential schools? Only because there are the parents are not able to really good good education facilities at their place. So we have to bring all the students to a particular place. They are coming from different places over there. So when they come from different places, they also have different cultural backgrounds, because as you know, the things vary from place to place, even in the same locality, in the same districts also. So,
in fact, in every school, there is a provision for day scholars also. So for every 40 resident children, there are 10 day scholars. So it is up to the parents on what to do. And migration is a major problem among tribals. So when they migrate, they used to take their children also along with them. So their education would suffer. So that's why the option for residential schools.
Also, we've got Eklavya Vidyalayas, and Eklavya Vidyalayas are supposed to have no effect. They are schools of reputation. They're working in tribal areas. You have a excellent school where there has been admissions based on certain screening. And when these schools work, you have got a domino effect for other peripheral schools that are over there, and you will find that the schools of reputation also happen to have good effect on increasing the entire academic atmosphere within the village or within the community also. So, of course, culturally consciousness and solutions tailored to localized context are important, and they are relevant. In Chhattisgarh also, we are working towards this. And Education City, when I was district collector in Dantewada, we had established what was known as the Education City. It's a hub of almost 10,000 residential facility for different kind of polytechnic college. There is an ITI. It is adjudged as the 100th structure in the world by KPMG. So such institutions, actually what we found, had a ripple effect in the entire division of Bastar, where people wanted to aspire to be there. There was another scheme known as Prayas, which is basically a residential facility from class 9th onwards for all IIT JEE aspirants and NIT aspirants. And they are all tribal students. And you'll find the intake, we started this in 2009. And today, more than 200 plus IITians from Chhattisgarh are excelling in different IITs in India. So these are excellent schemes, and it is nothing about uprooting somebody from their culture. We are living in an age of competition and excellence, and it's just driving people towards those aspirations and achieving and thriving in this world.
Hello, ma'am. Um, my name is Dr. Nitin Durve. I am from Melghat. I am currently working in medical officer. मैम मेरा एक प्रश्न था कि आप जो क्वालिटी ऑफ फूड की बात कर रहे हो, तो प्रॉब्लम है सिर्फ बच्चों को खाना ही नहीं पहुंचता है, आश्रम स्कूल की बात कर रहा हूँ, और 10वीं 12वीं के बच्चे को सिंगल लाइन अच्छे से पढ़ते नहीं आते. तो ये आज भी रियलिटी है. मुझे ऐसा लगता है कि इसमें सर्वे होना चाहिए, बात होना चाहिए. जो ट्राइबल ये अच्छी बात है, लेकिन जो क्वालिटी है वो नहीं है, अभी भी नहीं है. आप सर्वे करके देख लीजिए. मुझे ऐसा लगता है, और मैं ऑलरेडी 6 साल आश्रम स्कूल में पढ़ा हूँ. थैंक यू.
Hello. I agree with Dr. Nitin. The quality of school in tribal ashrams was really very poor. I was part of Saunke committee, which has given suggestions for deciding policies for reducing mortality of tribal ashram schools. Madam, thanks for accepting a lot of recommendations of the committee. But I have one question. When we analyze the data of last 5 years of deaths in ashram school, we found that suicide is one of the major cause of absence of students, and sexual harassment by the staff was the major reason. And we have given the recommendation to appoint a female as a warden for ashram schools. What about that recommendation? Probably it has not been implemented. Compulsory
No,
female warden.
most of the recommendations of the Sarunki committee have been implemented. And at present, for every girls' hostel, there is compulsorily a female warden. If the position is vacant, a female teacher is given the charge, and she is supposed to stay there.
Because in Melghat, there is lacunae of female wardens.
Yeah, but we have taken people on Rozandari basis.
Okay, thank you.
And they are working there.
Thank you.
And our earlier ACS sir was Dr. Vyas, who himself is a pediatrician, and he was the one who suggested that we should work with NIMHANS. And because of his initiative, tribal department is working with NIMHANS. And regarding quality of education, I agree as to what you say. So for that, what we are doing, people who work in the field of education know of an NGO called Pratham, which is a very well-known NGO, and it gives the ASER report, the annual status of education report. And so now we are working with Pratham for 3 years, and Pratham is doing the assessment of the tribal children, and they are also training our teachers and also training the superintendents. So that is what I told you about. As per the Salunke committee findings, we are doing a lot of things to implement all their recommendations.
Excuse me, ma'am.
I like to highlight one only with two glimpses. Just Praveen sir shown the one glimpses that our Sikh lady carrying wrap up in the blankets and chadar, they carry this lady to the hospital. Today also situation is the same in the Gadchuri districts. This is the one glimpse. And second glimpse, a few days back, we saw that the India landed on the moons. Both the glimpses, tears come from the humanity, because you are all the peoples believe in the humanity. One, the tears which give grief to the people that there is no facility to take the tribals people to the hospitals once. And one glimpse which give the most of the joys, we are गर्व से छाती फुलना बोल सकते हैं अपन कि we landed on the moons. So on behalf of the tribal symposium, the gaps between the huge diversity of the giving these services to tribal faculty, tribal peoples and the other peoples. I hope that the symposium, the panelists which they discuss lots of more these were, because madam already mentioned that there is a migration in the community, but why there is a migration, we also think on such situations also. So I hope that some of the gaps which will be bridged on by this on this situation. Okay, thank you.
Thank
Excuse me,
you.
ma'am.
Thank you so
Lot of
much.
work, just a minute, ma'am, one question. Lot of work has been done regarding the wasting, underweight and stunting of these tribal people. But one basic thing I just want to say, ki human happiness index might be missing in those people. And what we other NGOs and government organizations are trying for that, to maintain the happiness index of those people. And the second part of the question, as Dr. Sato has said, people were feeling that they are getting punishment while going to the tribal areas. But as you have said, you are making the tribal to get the admission in IIT and NEET. So why don't you take the undertaking from them to, while you are becoming graduate, you must have to work over there in the tribal areas.
This could be a policy formulation.
I would just like to tell you that Dr. Madavi, who just spoke before you, he's a product of one of our ashram schools.
Thank you.
Thank you all.
No, I'll just
Yes,
add a
ma'am.
comment. Firstly, I thank all the panelists for accepting our invitation and, explaining to us that there's so much work going. I can assure you, your task is extremely difficult. You're like that parent who has an empty vessel but has to feed 10 children. So whereas you may want to do, you have to keep doing it. And I think, yes, the Akshay Patra, which was there with you, I think if there are any holes, they need to be plugged. And that is there'll be enough food for at least giving everyone. So that's one thing. The second thing is the aim was to understand the issues you all have. And as healthcare professionals, I think, and what you brought out of the multi-sectorial, intersectorial collaboration, I think that's where, which I said on the first day, an organization like Sangam comes in, which the chief secretary was here and we've created in the state, which is synergy of academia networking with government, allied health and medical. And for everyone, the Nandurbar story or the Blossoms where Thakreji has done this, or you're running out. So I think for us also, I think we need to understand what the problems are and work together to find solutions, because the problems will be plenty. We will keep going on the moon. We'll still have ambulances. That is our land. That is our diversity. And we will remain with the gaps. So I think unless everyone makes effort, what we not by saying there's a problem with everyone else other than us. So let's begin with us, and I think that's where we'll be able to. I thank all the panelists once again for really taking our invitation and giving us some answers.
Thank you so much.
I just request.
Excuse me, sir. Just one question. Do you feel ma'am has mentioned about the mental health that NEEM has you, and after you identify the students, the tribal ashram school students under stress, and then you give them a modular thing. Do you think there is a need of or a role of a moral education in a preventive measure, like starting at the age of 8 years to 18 years? We should start giving them moral education and directly putting them to IIT and NEET. Do you think we should give them the abacus or the additional training what we used to get in the urban schools, so they are also having that talent? We know whenever we get opportunity as a tribal, we can shine, and we are proud of our tribal IS officers sitting over there. So that we just need that guidance and light at that right time.
As I told earlier, the tribal department is the guardian for these 6 lakh children, and we are trying to work on so many aspects. As I said, health is not just physical health, it is also emotional health, it is mental health, it is psychological health, and also socio-economic learning. These are also very important. That's why I told you all the initiatives that we are taking. I don't say that it is 100% effective, but it will definitely make a difference to lots of lives of tribal students.
And we just wanted to mention from GDC, the storm is coming toward the tribal generation, and it's oral cancer. So few points should be, addressed, or few policies should be addressed over there. Just before making it a big issue.
Yeah. Question though, but we are really running short of time. We are beyond time rather. It's very pleasing to see such an and captivating crowd we have here. So thank you so much. Thank you, our respected moderators and panelists.
Thank you all of you.
To felicitate our panelist members, I would like to call upon to felicitate Miss Reena Kangale, IAS Chief Election Officer, Chhattisgarh, Raipur, India. I would invite Ms. Precious Narambi, Founder and CEO, Vessels of Virtue from South Africa. Ma'am, please welcome and do the honors. Thank you, ma'am. To felicitate Dr. Praveen Gedam, Divisional Commissioner, Nashik, India, I would invite Dr. Carolyn Stephens, Professor of Global Environmental Ethics and Health, University, Slovenia, and visiting professor, UK. Carolyn is an international advisor, reform of Brazilian indigenous health system. Welcome, Caroline. Next, Miss Naina Gunde, IAS, Tribal Commissioner, Nashik, India. To felicitate ma'am, I would like to call upon Dr. Jala Wilhelmina, former Health Minister, Republic of Liberia, West Africa. To fellow our final panelist, Dr. C.B. Pradesh, who is a National Officer, Tribal Health, World Health Organization, New Delhi, India, I would invite Dr. Annie Chang, Professor, School of Medicine, Queensland, University of Technology, Australia. Dr. Annie Chang, we would request to felicitate Dr. C.P. Pradesh. Now it's time to felicitate our moderators. To felicitate Thank you, ma'am. Now it's time to felicitate our moderators, Mr. Ravindra Thakre, IAS, Additional Tribal Commissioner, Government of Maharashtra, for which I would request Professor Leon Toshililo, Professor of Pediatrics and Hematology, Official University, Democratic Republic of Congo. To felicitate our second moderator, Dr. Yogesh Jain, I would like to invite Dr. Jelita Chinyong, former Director, Ministry of Health, Health Expert General and Social Affairs, Zambia, West Africa. Dr. Jelita Chinyonga, I would request to felicitate our moderator, Dr. Yogesh Jain. We would request the panelists, moderators to assemble for the group photo. Thank you, all the dignitaries. Thank you for your valuable time. There's an important announcement. The participation certificate to all the participants, delegates, will be given physically after the valedictory function around 6 to 6:30 p.m. So we are towards the end of this extravaganza academic feast, FIST 2025. So the last scientific session, we have on the theme, Interesting Insights from Tribal Territories, for which I'd like to invite our chairpersons, Dr. Sunita Kumbhar, Professor and Head, Department of General Medicine, AIIMS Nagpur, and Dr. Pavan Kumar Godatwar, Technical Officer, Traditional Medicine, Department of Health Systems and Life Course, World Health Organization. We welcome the chairpersons on the stage. I feel honored to invite the speaker, Dr. Naira Makarchian, psychologist, the Republic of Armenia, to please present her talk. Please give a big round of applause. Let's welcome our final speakers, Dr. Myra Makarchian, psychologist, Republic of Armenia.
Can you hear? So how I'm just like this. Okay. Okay. Yes. Good. So namaste, everybody. I know that this is the last session of the last day, and you are very, very tired. I know, but you listen to this talk. It is worth of it, and it is about the language of dreams, specific symbols revealing health issues. So you want it or not, you remember them or not, but dreams are part of everybody's life and the mysterious part of our life. Dreams have captivated human imagination for millennium. They offer a glimpse into our deepest fears, desires, and unresolved conflicts, often acting as messengers from the subconscious. I would like to mention now one Chinese philosopher's dream. He lived in 4th century BC. This we come to know from history. So he saw in a dream that he is a butterfly, and the butterfly saw in his dream the Chinese philosopher. So he woke up and he was so confused. Now who I am? This philosopher or I am a butterfly? So he was thinking a lot on this issue and he came to a conclusion. He made his own concept that we exist at the same time in various directions in other worlds which are not connected to each other. So, dreams are highly subjective and influenced by personal, cultural, ethnic, and psychological factors. A symbol in one person's dream, might carry an entirely different meaning for another. From ancient times, people have paid close attention to dreams, and all the ancient civilizations, all the ancient traditions have their own symbols of dreams. They have their concepts, there are manuscripts written about them. So more than 3,000 years ago, the authors of sacred Upanishads described the dreams as higher state of consciousness than wakeful situation is. There are references to dreams in the Rig Veda, Ayurveda, Puranas, Chandogya Upanishad, and other classical Sanskrit literature. In Ayurvedic literature, the dream has been described from physiological, diagnostic, prognostic, and therapeutic points of view. I will mention also the Tibetan medical treatise, which is called The Heart of Amrita, the Eightfold Tantra of Secret Oral Instructions. And the short name is Chuchi, 4 Tantras. And here there is a special chapter about dreams and about illnesses, the symbols of illnesses in the dreams. Let me mention about Hippocrates, the father of Western medicine, ancient Greek, a philosopher of 5th century BC. He wrote a treatise on dreams, and he is telling, if in a dream the stars are dim or move downward to the ground, then this is a sign of physical weakness. An upward movement indicates an abnormal state of fluids in the head. The movement of stars in the sea means diseases of the organs. The movement of stars to the east means tumor growth. But he is saying also that if sleep relieves suffering, then the disease is not fatal. Another philosopher, Greek Aristotle, he wrote on prophetic dreams, and he says that it can also be in case of diseases and various conditions of the organism, which are perceived even at the stage of occurrence, before being perceived by a person while awake. So in 21st centuries, there are many scholars who are doing research on dreams. I would just mention only one person here, Russian physician Vasily Kasatkin. He wrote Theory of Dreams. And he, in 30 centuries, in 30 years, he interviewed 1,410 of his patients and analyzed 27,300 dreams and to the following conclusions. The signals of the onset of the disease can sometimes be too weak to excite pain receptors, but strong enough to innervate the sensitive optical region of the brain that generates dream images. Please close the door, please. Thank you. For example, dreams focusing on high blood pressure begin to appear 2 to 3 months before the disease becomes apparent. For tuberculosis, this period is 2 months. One of Kasatkin's patients saw blood and fire in his dream, felt cold and anxiety. A medical examination confirmed Kasatkin's preliminary diagnosis of rheumatic heart disease. Another man dreamed that he was buried alive under the rubble of a collapsed building. He was soon hospitalized due to high blood pressure. A woman who dreamed that she was trapped in a narrow gap was subsequently diagnosed with tuberculosis. Now let me tell you about common symbols of illnesses. That means for most of the people, they are the same. I will tell. Start from raw meat. This means any illness. If a person sees raw meat, I don't know what is in Indian culture, but in Western culture, in our culture, it is like that. If you see raw meat, then you will fall sick. But when you see that this meat is cooked, boiled, that means your illness will be cured. I will give one example. A woman dreams that her husband offers her a large piece of raw meat with a banana on it. Let's recall the Western Austrian psychotherapist Sigmund Freud. According to him, any long items you see in your dream, that means that symbolizes man's penis. So here we can come to conclusion that through husband's penis, the disease was transmitted to his wife. Another, fat pork. This means a stroke, blockage of blood vessels, heart attack. Another bad symbol is jam, especially cherry jam. This is inflammation process. And if jam is mixed with raw egg, that is inflammation process too much, which can lead to irreversible processes. Then if a person sees that he's strangled in the dream, beaten on the chest, put on tight clothes, this means that he will have problems with heart. Another one, buried alive, drowning in the water. A great weight is pressed on the chest. This means problems with the respiratory system. If you see spoiled food, that is, check your liver and pancreas. If a person sees that he can't move, carrying some weight, sitting on the knees, put on tight shoes, chained or beaten with stick, he must be having joints or spine problems. Attack of troops also can mean sickness, like the illness is attacking you. Another, the early symptoms of Parkinson's disease. The person can see a fight with a terrible creature in a black cloak and hood. He could see that furniture comes to life. Household objects begin to talk. By the way, my uncle had a Parkinson's disease, so all these things I could see with him. And also the same thing he could see in real life. A pillow is talking to him, like these things. And but he didn't want to accept, to believe that his disease is not curable. So once he saw such a dream, he saw that somebody told him in the dream that orange, when you see orange color, that symbolizes not curable disease. Then he saw an orange cap. Somebody was holding it, and he asked, whose cap is this? And they replied that this is yours. So the dream told him that you have incurable disease. Another one, aging process begins to a person when you see in the dream that an old man or an old woman gives his seat to you. And sexual intercourse with an old man or an old woman has the same meaning, because seeing sexual intercourse in the dream means that the capabilities, the character, or the features of that person is transferring to you. So in this case, old person's feature, that is old things, so you will become old. Aging process. Someone prettier, rejuvenated, that person will become ill, infirm, and physical appearance will deteriorate. Dreams of being young can mean that the person will soon die. This also can mean it. If someone is ill and dreams of death, that means his health will improve. Very good symbols in the dream are peeing, bowel cleansing. That means that the person is cleaning himself, and he is cleaning also his mind. Now, I would tell something about Corona, since we came came out from that thing. So during Corona, many people saw that there is a typhoon coming, there is earthquake, the beds are flying to them. And I will mention one dream here. This is my dream I saw. So I see I'm in the cave and a lot of bats are coming towards me. A lot of people are there, so bats are biting these people. And I was so scared, but one bat came to me. It just slightly touched my cheek with its wing. So I got Corona, but it was very light. I mean, like in 2-3 days, I was recovered. So this is a very interesting symbol. Now, let's see the different nervous exhaustions in our dreams. Number one, first stage, is when you see a cat. Cat is pleasant, soft, not aggressive, but already this nervous system starts. The same can mean the rabbit. The next stage is cockroaches, worms. For example, one lady told her dream that we saw black cockroaches under the table of her computer. So the meaning is that she works too much at the computer, and it has already begun to affect her nervous system, peace of mind. One day my neighbor came to me. He's a 12-year-old boy, and he was like scared. I saw Nairanti, I have such a dream. He saw that the black, slimy worms are coming out of his eyes. What does it mean? This boy, I told him, of course, you are sleeping with your phone. This is the main problem. By the way, we have to take care of our children because they are too much in the phones. So the meaning is this boy got into a habit of playing games on the mobile in the dark at night before going to sleep. So as a result, it affects not only his vision, but also his mental state. So the third stage is the mouse, and the fourth stage is the devil, Satan. This is the horrible situation, serious mental disorder, and as is known, mentally ill people and chronic alcoholics usually see devils in their dreams, and even in reality they can see. So besides these symbols, there are also individual symbols of diseases. Let's go. So, individual symbols. One man shared with me that when she dreams of warm water, it signifies that she will fall ill. However, when she dreams of cold water, that means she will recover. I will give an example of individual dream. One lady saw that two trucks are coming to her and they are like squeezing her from the back and from front in the part of her waist. When she woke up, she was scared and she thought that I will go to the doctor. And what came out that she has problems with her kidneys. And the doctor, she went to Tibetan doctor. So the Tibetan doctor said that don't eat food have cold energy, that is potato, curd, and rice. And after a month, when she did that diet and taking Tibetan medicine, she saw in her dream that these trucks left her and they drove away. Then one man dreams that waves of death are closing on his heart. So soon he got heart attack. I had a colleague, she was pregnant and she was soon to give birth. And one day she came and said, you know, I saw in a dream that there is a knife under my bed. I said, you will get cesarean section surgery. No, no way, I have just checked up. I have no problem, I will deliver myself. But after a few days, we came to know, we got the news that she suddenly was not well and she was done cesarean section. Now, let's see the symbols of depression and mental health problems. When you dream that you are lost, you are at a dead end, or you see endless stairs and doors that do not lead anywhere, that means that this person is not able to decide how to react to a certain event in life. He is unable to make the right decision. I will. So, okay, we don't have time. I will just skip this. Just one dream of a lady who committed suicide. That day she saw this dream, which then afterwards told me her mother. So she saw herself that she's in white, high-heeled shoes with thick, heavy books under her arms. She descends from the mountain into a pit, the walls of which are gradually narrowing, the ceiling drops, and she finds herself in a dead end. Now let's analyze this. So she found herself in a dead end of life. She didn't know what to do. In her opinion, the only way is to commit suicide. So what this symbolizes? Her shoes, white shoes. In the dream, white color symbolizes liberation, freedom. And when you see that you are wearing shoes in your dreams, that means that you are already ready to make step in your life. So she made a step in liberation. So she threw herself from the 8th floor. So very sad, but what to do? Then, if you see that there is a eclipse, that can mean also the mental illness. Now, I will give example. There are dreams also that offer clues and guidance for healing. And let's go to history, 20 years, centuries back, to Alexander the Great. He once, during one battle, his very close friend Ptolemy was wounded by a poisoned arrow. And Alexander was very, very worried what to do. My friend is dying, what to do? And he saw a dream. By the way, this is also very important technique you can try when you have one question which bothers you and you want to get the answer. You just before sleep, all the time you think about that, you ask that question, and in the morning you will get the reply. So what reply got Alexander the Great? A dragon, and this dragon was holding a plant in his teeth. And the dragon said that you find you find this plant and your friend will be cured. So immediately Alexander called 200 very good, very fast soldiers. He described the plant and they went to many directions. Soon they came back, they brought the plant, and not only Alexander's friend was cured, but also other soldiers who were also wounded by poisoned arrows of the enemy. Let me tell you that so these curing remedies are coming from the other world, even from our dead ancestors who. So one girl was telling that now lady, she said that when she was 19, she was diagnosed that she has a very severe diabetes, and the whole life she will take insulin. So she was very worried what to do. She was upset, and she went to sleep. And in her dream came his grandmother's brother, and he said, you eat coconut kernel every day for a month and you will be cured. She was so surprised. Why this man came in my dream? I saw him only once in my whole life. But she said, okay, nothing will happen. So she ate. Day she was eating this coconut kernel. And already after 2 weeks, she felt herself very well. And after a month, there were no symptoms of diabetes. And now it is 25 years past, and she has no problem with diabetes. So I could tell you many other things, but we already know don't have time. So just I would tell the dreams are the curse of the soul. Listening to them is the first step towards healing and understanding ourselves. And thank you very much for your attention. And thank you. And I'm open to joint research with my colleagues in this very important, interesting, and why not, mystical sphere. Okay, thank you.
Thank you, Dr. Naira, for a wonderful presentation that took us into the mysterious depths of mind. Thank you again. Another speaker from the Republic of Armenia, Dr. Lilia Tadevosyan. Please help me invite Dr. Lilia. She's PhD anesthesiologist, reanimatologist, Scientific Center of Traumatology and Orthopedics, all the way from Armenia.
Thank you. Good afternoon. Yes, thank you. Yes, thank you. Honorable Madhuri ma'am, ladies and gentlemen, dear colleagues. First of all, I thank God for this day. I thank God for the opportunity that I am here today with you, and for the opportunity that I have the possibility to represent the Armenian people in my country. I thank my family. I thank you. I thank Dr. Sanjeev for invitation. I thank my best friend, Dr. Naira. I thank everyone, and I expect your patience to stay here a little bit more, and we will finish this such a great event. So let's understand, what is Armenian disease? Why the disease is called Armenian, and what does the schizophrenia have to do with it? Let's look at the world map. Here it's Armenian Empire during Tigranes Great. And here we can see from sea to sea Armenia, which is covered between three seas, Black, Caspian, and Mediterranean Sea. And this one is Armenian Kingdom of Kilikia, also covered the territory around Mediterranean Sea, around Mediterranean Sea. Now, this is Armenia till 2020. Why 2020? Because in 2020 we had war with Azerbaijan and we lost this much of our lands. As you can see on the maps, Armenians lived in the Mediterranean basin. And from the big and huge empire, Armenia turned into the small country, which left a big mark on our population genetic code. This map is shown the migration of Armenians from their historical homeland to Armenian highlands. Here is western, central, and eastern part of Armenia, and this is the migration road. So why it is this much important? Yesterday we heard and got very interesting knowledges about genes, genetic code, and the influence of rice and environmental factors on the genetic codes. Armenians are a long-suffering people. They have faced many wars, resettlements, and even genocide in 1915 in the Ottoman Empire. Apart from geographic consideration, the division of modern Armenian groups is based on their linguistic, historical, and cultural peculiarities. While here in this diagram, we can see how Armenian disease is spread all over the world. So this was shown analysis of population structure, genetic relationships, and population size histories of modern Armenians. Different colors indicate residents of different parts of Armenia, Western, Eastern, and Central. Yellow and purple colors indicate the population living in the territory of modern Iran and Turkey. That is, the population was most often subjected to violence and survived genocide. So the first time the disease or periodic disease was mentioned by Mkhitar Heratsi. He is our Armenian classical medicine founder. And in his consolation for fever treatise were mentioned about this periodic disease. The After, in the 19th century, physicians began documenting recurring fever syndromes, particularly among population Mediterranean. Mediterranean because the ancient people in the Mediterranean basin were lived, such as Arabs, non-Ashkenazi Jewish, and Armenians. So, what is Armenian disease? Armenian disease, also known as paroxysmal polycerositis or Mediterranean fever. It's an autosomal recessive autoinflammatory disease that occurs with high frequency in the population who lived in Mediterranean basin. So disorders is caused by mutation of MEFV gene, means Mediterranean fever gene, which is located on 16 chromosome and encodes the protein pyrin, which is responsible for body's inflammatory. And as we understand, the mutation of this gene may lead to unresponsible and the irregulation of immune system. Immune system become overacting as a result, it leads to periodic inflammation. So more than 300 mutations in the AMFV gene have been identified. And the most common mutation in the Armenian population is M694V mutation. Here we can see also two another specific mutations for Arab population and for Jewish population. Clinically, Armenian disease manifests as a recurrent crisis of fever and serosal inflammation, leading to abdominal, thoracic, and articular pain. These episodes may last anywhere from a few hours to several days. And after the attacks, patient feels healthy. So epidemiologically, men are more susceptible in ratio 1.5 to 1 than women. And in each 200 individuals in Armenia, each one suffers from Armenian disease. It is very high because Armenian population only 1.5 million. So it means each 16, one of 200 people are suffering, and each one from the three is carrying. So why Armenian disease is dangerous? Because the most serious complication of Armenian disease is renal amyloidosis. Now, let me to answer to the second question, why the disease is correlated with schizophrenia. As we have seen, Mediterranean fever significantly impacts the quality of life for patients. Very often, patients undergo unnecessary surgical interventions when the symptoms, especially abdominal pain, is misdiagnosed. In this diagram, we can see operations which held in 55 patients, totally did 82 surgeries. So what this means, which kind of surgeries? We can see appendectomy, cholecystectomy, exploratory laparotomy, hysterectomy, splenectomy, even splenectomy. So from 82 surgeries, 15 was unnecessary, and only 12 from 82 was really patient needed. So what does it mean? It means that patient which often suffering with unknown pains, they don't understand what happens, they got misdiagnosed, they got surgeries, and from this diagram we can understand that even one patient may have more than one surgery. Means one patient unnecessarily got surgery more than one times. And of course, it affected to mental behavior and mental disorders of mental behavior and mental health of our patients. The disease typically worsens following physiological stress, which can trigger or intensify episodes. As a result, patients become mentally labil, hypersensitive, and even aggressive, further complicating their physical and emotional well-being. I found in the ancient text a very beautiful explanation of all of this. Very beautiful explanation of all of this. Dhidharya Atma Divignanam Mana Dosha Saoshadham Param. It means the knowledge of intelligence, patience, mental stability, knowledge of self, soul is ultimate treatment of mental disorders. So the treatment of Armenian disease, also known as Mediterranean fever, as I told, treatment should be comprehensive. The drug which we use is colchicine, and of course, hard working with psychologists. So we do all this for the sake of the revival of a new and pure life. This is my patient after cesarean section. So whatever we do, whatever is holding on here now, it is for our future, pure and new life. And it's me with my activities. I am with Austrian astronauts. I was their doctors. I am with my students, and I'm very impressed. This is my student. It is our photography in her room. Thank you for your attention. Thank you for everything.
Thank you, Dr. Lilia, for a wonderful and compelling presentation. We are overwhelmed. I would like to mention Dr. Shashi Thakur, who was supposed to be with us. He is a former Joint Director, National Health Mission from Bhopal, Madhya Pradesh, India. Unfortunately, sir, she met with an accident, but she is doing fine. And out of her commitment, she has sent the presentation, which would be presented on her behalf by Dr. Anuj Singhal, who is a medical director of Swami Vivekanand Health Mission Society, Uttarakhand, India. Please help me welcome Dr. Anuj Singhal.
Once again, namaste to everyone. We are at the end of this conference, and first I pray for the speedy recovery of Shashi Didi. So she's my mentor also, and she has worked a lot in tribal area, northeast, as uh, it was there in her introduction. So she has requested me to present on her behalf. So, या देवी सर्वभूतेषु मातृरूपेण संस्थिता ता नमस्तस्ये नमस्ते नमो नमः. Goddess resided in maternal in all living beings. I salute them. A few words about the holy Narmada river are a symbol of spirituality. Beginning from Lord Shiva, latest Adi Shankaracharya did tapa at the bank of Narmada river. In Bharat, lakhs of people surrounding the river, either on foot or with vehicles, ended in the same place. So that is Parikrama Narmada river. She did in this slide, and along with that, uh, she took care of the pregnant women also, and did some blood test and provided the medicine to them. So antenatal checkup during Narmada Parikrama. So both spiritual as well as seva. So how it started her life? She was in Assam while serving in that area, tribal area. One day people came to her from a hill in the forest about 10 kilometers for a request to see a woman unconscious in the village who aborted 2-3 days ago. She asked them to bring her to our hospital. When they bluntly refused, I am with two Kurbi teachers, that was the Kurbi area, able to convince them. They brought her in a coma, that was cerebral malaria. When after 2 days of regular treatment, she uttered some words, and that patient recovered. So that totally changed their beliefs of tribal peoples. So aims and objectives of that Narmada Parikrama and that care of that pregnant woman was to identify and manage high risk pregnancy, to contribute to the reduction of maternal mortality and morbidity rates, to educate and raise awareness among mothers and communities on safe delivery practices and child health care. It is said creation is an ongoing process in universe. When a woman gives birth to a child, she not only brings a new life into the world, but she is reborn. The pain of childbirth is a unique and transformative experience that can only be truly understood by a woman. So challenges in tribal areas. So everybody knows now this thing in so many presentation it has been discussed. Infrastructure and accessibility, socio-culture barriers, economic challenges, health related challenges. So maternal health indicators. So
this data is also presented. ST, so little bit lower. Fertility rate is high, and contraceptive usage is almost 50%. And again, those data has been shown in previous slides also. These are the ST population census, and this is the Narmada River Yatra. So it was conducted from 27th March till 24th April 22. So it started from the Yatra Prabram, you can see from Khandwa, Omkareshwar temple on 27th March, then it went to Khargon, Badwani, and so on, and it finishes in the Khandwa only, Omkareshwar, on 21st April. You can see all the Yatra. So this is very religious travel. So material and method. So under the aegis of Vanvasi Kalyan Ashram, an NGO, they have done antenatal checkup and Garbh Sanskar also with the help of 20 devoted gynecologists and government in 18 blocks of 16 district of tribal area of Narmada River in Madhya Pradesh. So first they registered the pregnant woman, and investigation were done, hemoglobin, RBS, blood group, HIV, all viral markers, and sickling test for sickle cell anemia, and history of patient is taken along with the vitals, and checkup by gynecologist, and high risk patients were referred accordingly. So high risk pregnancies related with asthma, hypertension, uh, HIV, HbSG, diabetes, underweight or overweight, short height, first surgery, other complication in pregnancy if first child was stillborn or deformed, complication in previous delivery, and sickle cell anemia. So first they used to do Garbh Sanskar and some Narmada Aarti and Bhajans with the woman, pregnant woman, and after that they started for the camp like to record vitals, registration, and checkup of the pregnant women. So this is Reva Sangani Seva Yatra. You can see they used to do havans and puja, bhajan, everything, and they used to give awareness talk also during the pregnancy. So these are the in different areas the anemia trend. So so these are some slides. Sorry, because I have not prepared it, so I won't be able to explain it properly. And screening of this even young pregnancy, these are the things. So this is the master chart. So very well documented, you can see. And total 5,504 pregnant women were studied, and 937 cases were having moderate anemia, while 473, almost 8% cases, were having severe anemia. More cases of anemia is seen more in Sioni and Barwani district, and Sukhatwa and Kundam. And in 142 cases had features of sickle cell anemia, and there were 196 cases of IUGR and more due to anemia, and 63 cases of bad obstetric history, and in history they have lost 1 to 2 child earlier during pregnancy within 1 year of due to pneumonia or malnutrition. 66 cases were of PIH. So as our study, anemia is a big threat to mother and child. Anemia directly and indirectly causes morbidity and mortality of the pregnant mother. Young pregnancy, 16 to 17 years, is a common age in tribal zone. Interval two children in all women were very less, only 1 to 1.5 years. So that is one of the cause of anemia also. And bad obstetric history, IGR, are also responsible for malnutrition caused by anemia. if there is a gap of their recommendation, at least 3 years between two children, it is a well-known fact, infant and child mortality can be reduced. And reproductive health and health education is mandatory in adolescence so that child marriage and pregnancy can be avoided. For malnutrition and anemia management, local nutritious food should be included in the diet, and regular antenatal camp should be organized so that high risk pregnancy can be identified and can be treated. Garb Sanskar program. So main objective of this program to improve maternal and fetal health, to promote overall development, physical, mental and emotional growth of pregnant women. So component of this program is yoga and pranayam, music therapy, storytelling, mathematics, havan and mantras. So program benefits are excellent pregnancy outcomes, holistic development, empowerment, equip pregnant women with knowledge, skill and confidence for a healthy and enlightened motherhood. Suggestion for government what they gave. So regular audit of infrastructure and human resources, ambulance availability, make sure ambulance availability, and testing of local crops and forest products in relation to food values, and research of tribal system of medicine and its standardization. And Anganwadi and Asha work should be regularly trained and sensitized, and special program for tribals, need-based program, and suggestion for the organization and society, maternal and neonatal health, nutrition, hygiene awareness program, regular ANC checkups, child health camps, and connect with the small scale industry and skill development plants, and mobile medical units. So previously it was there. So regularly mobile medical unit can go to their villages for the regular antenatal checkup and to identify high risk cases and to do that. So it was an effort, a commitment, a resolution. It's continuous journey and regular consensus. Thank you. Sorry, because this was the presentation of Dr. Sasi Thakur. Maybe I would not have been justified properly. Thank you.
So we really appreciate your gesture and we are overwhelmed to hear from you. I would invite our esteemed speakers for this session. Please come up on the stage so that we can felicitate Dr. Lilia, Dr. Naira, and Dr. Anuj Singhal. Please come up on the stage. I would request our chairpersons to felicitate our speakers.
Any questions from the audience are invited, because these both topics were very good. They are different from the routine topics. And the doctor's presentation was very fascinating. Dreams, everybody seems dreams. Some may come true, some may not come true in future. We don't know about that. But really, it's a wonderful idea of whispers from of the soul of God, which we get. So, and here again, we have got some fascinating and some words where there, like feeling of the death if the patient is having, but there is a tendency to in that patient. It is not opposite of that. Means the dreams of the death, they are not really bad in that way. Yeah. So you say no, the feelings of death or any which are the dreams of death, they can have a better outcome rather than the worsening of the patient. So yeah, it's a very different concept is there. So thank you for that very elaborate your lecture.
Ma'am, can I ask a question?
Yeah, you can have. Yes.
Ma'am, actually, it is quite a remarkable session by you on the dreams and how they are symbols of internal illnesses. I work with a community where the shamans in the community interpret dreams for people from the community. And because you specified that within in the maybe in the West, this is the kind of dreams. So I was thinking from your own practice, it seems that you do some readings of dreams for people. Could you tell us a little more about your practice and how it is different in different cultures, or if you would have had experiences on those lines?
He wants to share your data of long term, your study regarding dreams.
If I tell, it will be another session. It is too much. But a few things, yes. So as I mentioned already, the meaning of dream depends on the person's mentality, religion, where he lives, in which country, ethnic group. For example, a cow in the dream. If you see the cow here in India or in the eastern part, that means that this is a symbol of holiness for you. But in the Western culture, seeing a cow, it will have different meanings. If it is a light cow, that means it is prosperity and wealth. But if it is a black cow, that can mean illness, and also that can mean death even. The same with snakes. It depends on the person's this mentality, like how this person is like thinking. What is his attitudes towards snake? If it is he is afraid of snakes, this is different meaning. If he is indifferent, then so actually in our culture, snake means that this person is surrounded with enemies. And if you see that snake is biting, that means like these people are biting you with their words. And in the dreams, it is important names. Because all our names have their meanings, right? So according to that, we have to understand the dreams. For example, one person was told that in the dream somebody told her that Vishwanath wants to talk to you. So I asked her, what does it mean, Vishwanath? So she said that this is God's name, right? So what is wants to talk to you? That means you must listen to the nature's whispers, as we can say, what they are telling you. So you must be near God. So this is the dream telling them. Then I will, one dream also I will tell, and maybe we don't have time. So it's very interesting. You will enjoy. My friend, Indian friend, she is from Northeast. So she saw in her dream, she came to me, Naira, I saw in my dream that I'm getting married to Amir Khan. And she was like, will I get married to him? I said, no, relax. It doesn't mean that. So then, but in her dream, she was supposed to be the third wife of Amir Khan. Then her belated sister, her late sister, comes and says, don't get married to Amir Khan, get married to Salman Khan. So what is this? Now let's analyze, and you will understand how we analyze the dream. So since I don't know, I only that Amir Khan is a very famous actor. So I started asking him, so who is he? Is he married? She said, yes, he is married very happily. He has children. So I said, okay. And what about Salman Khan? So she said that he's not married. So he is like having not official relations. Okay. So I said, now tell me what happened with you during these days. So it came out that one foreigner lady, came to her. That lady has NGO in the Northeast. So my friend is also from Northeast. So she's dealing with Northeast culture, something. So she asked my friend that I all the time, I am not here in India, so be in charge when I'm not. And I said, so I understood. So you, like this, your dream means that you become member of this NGO, like deputy of this lady. But in the dream, the clue is you are the third wife. What does it mean, third wife? That all the work is on you, all the children are on you, but nobody sees you, and all the credits are going to the first wife, right? So in this case, she will do all the job, yes, but the credits will go to that lady, foreigner. Then the late sister comes to her. And this is also very important thing. We have to pay attention to the advice which is given to us by our late people, our relatives, friends, I don't know. So she said, don't get married to Amir Khan, get married to Salman Khan. What does it mean? Then don't be in official relations. That means don't become official member of this NGO. That will allow you, whenever you go, whenever you want, you go. Whenever you don't want, you can leave and go. Like this. So she was very happy. She said, yes, I understood. So this is this interesting example.
Ma'am, one more question, please. Are there past life experiences connected with the dreams?
Some people see
Past
their,
life and the cosmic energy. Are
yes.
they involved in the seeing various dreams?
So, in some circumstances, we can see our previous lives also in our dreams. Again, I will give one example. So, one Russian girl was telling me that she hates Germans, she hates German. When she hears that speech, immediately she is like trembling with fear. What happened? So again, we are coming to the thing that when you are thinking about something, you must see the explanation in the dream. So she saw that it is the time of Second World War. He is a small boy. She's a small boy, and she's like helping Russian guerrillas who fighting against the German army in the forests, right? So like he was the informer of the guerrillas. And so he is running from the Germans. They already found him, and the German soldiers are running after him. So he went, he hid himself somewhere, but they found him. So the soldiers are coming, talking in German language. They stopped where he was hiding, and darkness. So I said, we understood that because the Germans killed you, that's why in this dream, in this life, the hatred, the fear towards Germans is kept. So this is one example that dreams are connected to our past lives.
Thank you. Thank you so much. It was a wonderful participation. We would request our chairpersons to felicitate our speakers.
Without comments.
Excuse me, ma'am.
Her journey towards dreams and using us the same analogy of moving movies. Many of us have been reminded of Christopher Nolan's Inception, Leonardo da Vinci, Leonardo DiCaprio. Inception. I hope some of you have seen that movie.
Yes, sir. Thank you, sir.
Excuse me, ma'am. It was a very lucid explanation by Naira ma'am. I just want to know how she interpret dream is physiological. That physiological interpretation, can you please elaborate on that?
What do you mean physiological?
Physiologically, dream is a physiology. Na? Physiologically, we the dream. It's a particular stage of the brain. So, how can you judge by telling somebody tells you about the dream?
No problem. Actually, for her, dreams are not physiological. From where she's coming, she has bought into all the perspective from ancient times, historical times, mythological times, and cosmic, as said. So, as people say, some sleep and then dream, and for visionaries, our Lieutenant General, Vice Honorable Vice Chancellor Madhuri Kanitkar, they dream and don't sleep. And their vision keeps everyone awake. And let's go back to another very famous speech on dreams. I was reminded of that also by Martin Luther King Jr. in 1963 when he said, I have a dream, I still have a dream that our country rises up and lives up to its creed of the tenet the universal statement, which is all men are created equal. So coming back to our present topic.
And again, we have to awaken very slowly if you want to remember your own dream also. Otherwise, dream is not fully remember. Something strange or some fearful things only we remember.
And,
not
and, very,
all the things.
and just to very quickly bring up to speed of what some very recent decisions, again, my honorable colleague from WHO has brought in the UNDRIP report declaration and 23rd article, which was adopted by UN in 2007. In 2024, after 30 years of deliberations, traditional knowledge has been brought into WIPO declaration, which is also important. And tomorrow, the executive board, in executive board of WHO, the global strategy for traditional medicine 2025-34 is being tabled, which in the title, for the first time, includes the rights of traditional people, indigenous people. But in the title itself, it is not just traditional medicine, no, traditional medicine and rights of indigenous people. So let's come back to Felicity.
Thank you, all the speakers, for their judgment to this
Thank
topic.
you. I
and
thank
be in
the
time. Thank you.
respected chairpersons for moderating the session so well. I would request the chairpersons to felicitate our speakers. Dr. Naira. Dr. Lilia Dovisian. Dr. Dr. Anuj Singhal. Thank you for doing the honors. There's a declaration. The Armenian delegation, Dr. Naira and Dr. Lilia, would like to express their gratitude by presenting a token of love, for which I would like to humbly invite Lieutenant General Madhuri Kanitkar, Vice Chancellor, MUHS Nashik, on the stage, and Dr. Sanjeev Chaudhary. It's a beautiful gesture by the Armenian delegations.
Please, my dear, my lovely, my honorable Madhuri ma'am. When I saw your photo first time in the invitation letter which Dr. Sanjeev sent me, I was very excited from your smile. And I felt some kindness. I felt at the same time strength. Yes, yes. And when I saw you here, actually I'm excited. I can't find the correct words, but I'm very happy that I am today here. Also, we are today here. Yes, I am very happy that I could touch to your hospitality, to your everything. To your everything. Thank you, my lovely. my, this is our national symbols. It's pomegranate. Pomegranate, yes, represents health, wealth, prosperity in Armenia. And it's, yes,
Antioxidants. So pomegranate, even here in India, is considered a very healthy fruit. Science has shown a lot of antioxidants and facilitate value systems for immune modulation. And even when in our hospitals, people say, can we give the patient anarka juice, that is pomegranate juice.
national traditional symbols.
By that, madam's smile will become more and more beautiful.
Yes. And please, Sanjeev ji, please come. And this small, this symbol is for you. This is also pomegranate grapes. Yes, this is also the symbolic fruits of Armenia. And Armenia is a country where first wine was made many 6-7 centuries ago. So these are the wine vessels where we make grape wine. So this is for you. And so this is for the men or one-man army, as you told. But in Armenia, we also tell one-man orchestra. So this is Mr.
One man, one army.
We call one-man orchestra.
Orchestra is small.
Okay.
So he's one man army.
Yes, that's good. So thank you very much for your hospitality, for your invitation. Thank you.
It is good that you bought 2 pomegranates because there is a saying for in India about Bimar, ek anar so Bimar. Because that anar has got that capacity of curing hundreds of people.
Thank you. Thank you for the wonderful gesture from Armenia. I would request Vice Chancellor Madam to please stay with us on the stage. To felicitate our chairpersons, I would also like us to join with us Professor Dr. Milind Nikum, Pro Vice Chancellor of MUHS Nashik, and Mr. Sanjay Patil, Additional Police Commissioner Nagpur, to please join us to felicitate our chairpersons. Thank you. Thank you so much for your valuable time. I would request Vice Chancellor, MUHS, Lieutenant General Madhuri Kanitkar, Madam, to please share her views. I would cordially invite Executive Director and CEO of AIMS Nagpur, Dr. Prashant Joshi, to please join us on the stage. Welcome, sir.
So all good things are coming to a close end, but we have the grand finale because our Honorable Chief Minister is coming here at 5:30. So we have just that much time to work out, and we thought we before when the formal valedictory function, we won't be able to really get feedbacks from you. You'll have filled the forms, and I've got the interim analysis of the first 271, wherein, of course, most of the general comments have all been, it's very heartening to see that all of you all have rated it as very excellent or very good. Almost in every, this thing, 80% have rated it like that. But you can't, as a teacher, we all want to have things beyond. I mean, you're always looking for the next thing. So I value even more the open comments that have come in, because we want to do this maybe like the chief secretary said on the first day, that we should do it every year. And there were suggestions to do it region wise, so we have more experience. There were suggestions to include more these things beyond sickle, which I agree, because our blossom has shown that non-communicable diseases, so areas of this. There were comments on involving dental, oral, physiotherapy. So we had some very nice, and another very nice thing came in across was having a larger interactive session, which we would keep it in mind. So there, I really appreciate, because we are going to keep this compiled so that when we plan next time, we have these aspects. I particularly want to thank all the faculty members who came all the way from different countries and have shared some very interesting perspectives. You could see how even the last session, people were so fascinated whether with your dreams, and I had seen just one case of an Armenian for the Mediterranean fever. So I think it was very interesting to hear different things and how genetically some people get prone to more kind of analysis. So I think overall we've learned a lot from all of you who attended. And what we'll do is, before we go on to the award ceremony, I open up for two things. One is, if someone, since we didn't have more of interaction, if there are any questions related to, and a lot of our speakers are still there, so if there are any questions that you'd like to discuss some more, you can take a question. If you wish to give a feedback, we'll open up to that. And I'll request Dr. Joshi to now conduct the, questions and things.
We have some time for impromptu discussion. So if anybody wants to share feedback or want to discuss or any view, I request we welcome the participation from the audience, and I request Madam and Dr. Joshi sir, they can address the questions.
Absolutely. In fact, even if there are suggestions on, because at the end of this conference, we've had some very energetic, enthusiastic young. Are they still there? The people who are noting down decisions and policies. We had from the law university. We had some younger colleagues who were noting down findings that were coming on. So I think they have left now. But the plan is to come out with concrete suggestions. So you all are free to even write to Dr. Sanjeev Chaudhary thereafter also, if you feel that something will change, an idea that can change the outcome or how we can reach out. For example, I mean, when we saw some of those wonderful models that were presented, whether it was the thing in areas of around Nagpur, there was some things being done in Chhattisgarh, some other parts of the state, where we came across, or from our friends where they showed Ghana, having an app-based treatment for sickle cell with drone delivery of blood. So these were some very nice ideas which came in, which can be included in the policy document. So I thought we can open up for that.
Any questions are most welcome. I just have one suggestion, ma'am. I think it has been a wonderful 3-day conference.
first of its kind, very well attended. All the time the hall was always full. And since we are planning to have a policy document, would it not be good if in the next conference, which we plan to have next year, we could include some stakeholders and we could have a session with experts and the stakeholders so that they can impress upon them the need of bringing or changing whatever policy is there and what strategies need to be adopted so that they get sensitized at least initially so that when the document is submitted they are already sensitized and would be favorable for coming out with the implementable this roadmap. So,
I think that's a very good idea because in any case, the honorable minister who had come, he's going to call us for discussions. So we would probably go with some guidance from this and then involve stakeholders there for that discussion before we finalize it.
think if there are any, I think there are, yes, please.
Any questions or any suggestion? Yes, please.
We have already discussed, but still I want to, like I said, no state in the country currently has a tribal health policy. And I personally believe that decentralization is the way forward. So I request MUHS and AIMS Nagpur to take the lead on this and come up with a tribal health policy that will be the first in the country, and Maharashtra can lead the way.
I think that's a good suggestion. And in any case, I don't think in a diverse country like ours, where even two tribes are diverse, we can't have one size that fits all. So it would have to be region specific. So I think it could start with since the conference was held here, we could, and the problems of this area have come across with 2, 3 very large studies. It was the director who presented data from Ramtek, the Nandurbar data which came across are Blossom data. And it's not very different. It's similar. So if you could identify, once we have the problems which are identified, the policies can be who should do it, how should do it, in what time frame, what are the finances required. And we've been shown a number of replicable models. So I think that's the way forward.
Let me offer this to you, ma'am. WHO will be there to support you technically on this endeavor.
That would be a big help because then it comes out like a proper technical this thing. We can give the inputs. Yeah.
Yes, sir. That side.
Respected VC ma'am, Ayush, everybody knows Ayurveda, Yoga and Naturopathy, Unani, Siddha and Sovarikpa and Homeopathy. Other than Sovarikpa, all the disciplines colleges are affiliated with MEHS. I would like to ask you, is it possible to open the Sovarikpa institutions under MEHS? If yes, what are the challenges? Because in previous lectures, we came to know Sovarikpa really can play important role to improve the health status of peoples. Thank you.
I think all systems are very, very scientific in this, but for any university to start a course, there has to be a requirement which comes in either from some colleges or communities who would like to run it or from the government because it's a standard process after which the experts are called to make the syllabus and then it is converted from a syllabus to the assessment to the examination to the TEQs, stars. So the whole thing gets put in place. So it, even if it's a simple certificate or a fellowship course, we don't start it immediately. So it would have to do that. And I would ask our Pro VC if he can, because he's from Ayush. So
Yeah. So basically your question is right, but nobody is interested to open the college in Maharashtra because the faculties are not available of Sovarikpa. Only one faculty, I think he will also tell. He is the only faculty and whatever the course syllabus has been designed by the council, we are ready to accept that. But the our state has GR has to be mentioned, and anybody who is interested to open the college, they are welcome.
Thank you, sir. Anyone?
Yeah,
Yes.
one thing I want to ask regarding hello regarding Naira's question regarding your dream. There is the one question was asked regarding the physiological concept. Yeah. So in that, our Prakriti Parikshan has the concept of dreams. According to the dreams, Pitta Prakriti, Vata Prakriti, and Kapha Prakriti is mentioned. Also, the Charak has mentioned Arishta Kalpana, where the Swapna Arishta, where 1 month life is left, 2 months life is left, or 1 year life is left. That has been mentioned in our Granthas. So it has a better chance to elaborate with Armenian medicines. We can again develop our own science. Thank you.
Uh, I would actually, I think you've organized a great symposium. Only thing is, ma'am, also about I mean, a symposium is eventually defined as a discussion. And genuinely, this is probably the longest we've actually been having questions and answers. That was one thing that I've also put in this. Ma'am, especially from people who are presenting from India, I don't know about from the ones from abroad, but the representation from the tribal community itself was deeply missing in that sense. Lakshmi Kutiyama was there, but she spoke in Malayalam, but there was no translation. Means there was a summary given, but beyond that, the representation from tribal doctors or tribal alternative practitioners or traditional practitioners, the representation on the stage for them to be able to keep their point about what is tribal health, because this, I mean, because we had people who said we are working for the community and with the community, but the by part was missing. So I was hoping that
I
this
think that's a very good point, and that was the reason why in the tribal village we called the people to be, and that has become like the showstopper. Everyone's visited, including the healers, including healers. But their ability to come and make presentations or give talks, you can do it. The reason why it's called a symposium, honestly, we didn't expect this overwhelming response. It was supposed to be a smaller symposium, and my organizing person, Dr. Chaudhary, is not here, but he targeted 150, 200 people. Now, when it increases to 1,500, the whole, the structure of a symposium changed to a conference.
Yeah, ma'am. That
Small addition.
I think we are learning, so that this is the first symposium, so that all these things which you are saying, including stakeholders, including traditional healers, including people from the tribal community leaders, make representation of from each of these sectors to be able to voice uh, their ideas here. I think that would be a fantastic idea, so that we could improvise the next and
In fact, like I said, the overall, I was more interested in the open-ended suggestions, because they gave beautiful insights. So one could have more, breakout sessions, learnings from small group discussions. So there's a lot of scope for subsequent planning. Thank you so much.
A small addition, actually, if you could do something for revitalization of their own local health tradition, though there was a provision during 11th and 12th 5 years to revitalize that local health tradition.
So I think that will, I mean, how to revitalize the local traditions. I think that's important. So we need to have stakeholders people like Yogesh, people like, who've worked with the communities to really understand. We've remained working from the outside. We need inputs from the inside. Yes.
Thank you so much, ma'am, for hosting us so beautifully. It has been life-changing. My question is, since there's been a vast pool of wisdom, knowledge, experience, and all of that, can the dialogues be open so that what's also workable in our continent and in our countries, we can be able to replicate? Similarly, the same, what's workable in our countries can also be replicated. So like an open dialogue, not just for the Indian community, also for the rest of us.
Thank you for that suggestion. We'll definitely look at, because I mean that I'll speak for both of us, that the idea was the symposium came out of first setting up a tribal research center and a tribal chair. So Dr. Chaudhary joined in as the chair professor. Before that, we had Dr. Gode, who was the chair professor. So it began as small, this thing, and then we've done an MOU with AIMS. Again, a really state-of-the-art tertiary care center for research, so which already has a sickle cell center of excellence. So this kind of collaborations we are making, and I'm sure if that sort of this, we can look at the first possibility of keeping this website continuing as a collaboration and having dialogues from that into that.
Thank you, madam. First of all, I would really like to congratulate the entire AIMS and the MUHS faculty for a wonderful hospitality and the arrangements that they had done. One thing that I would like to suggest is, in all the researches, it was always the government hospitals which were involved, and as belonging to private institution, we would really like to partner and be a part of such research projects in future.
Absolutely. Thank you so much for that. I mean, like, you start somewhere, but the overwhelming response, like I said, and we are more fascinated as organizers from the young people who came in. And the director was sharing with me that people were actually Googling what are the openings. There were people who actually asked how we would like to go out. So when, our colleagues in the policy and the governance who said that we are not being able to get doctors, I'm sure this is where that doctors are ready. We'll have to find ways and means and reach out, and it doesn't matter private, government, uh, everyone has to. The multi-sectorial, which point came up from our WHO rep, who said that we need to have a multi-sectorial this, which it would include all.
Good evening, ma'am. Yeah, a small suggestion from my end. Okay, so after the end of the conference, I'm sure that we will be making a draft of this one and all those things. Is it possible, since MUHS and then you're the hem of the affairs, and then a chapter of a tribal health in the undergraduate curriculum? Can it be?
Yeah, see, putting a chapter is very easy. Today, every day, every specialist society comes to me with wanting to add a chapter. The question is, I think the undergraduate is already an overburdened, individual with a lot of stress. So I wouldn't like to put it as a chapter. I'd like to give it as an elective.
Oh, elective. Yeah, yeah, yes, ma'am. Yeah, so that
Colleges
colleges all across.
absolutely
Yes,
working on it.
yes, ma'am. Yeah.
And Dr. Amte and Dr. Anaga yesterday have already started work on some contact programs and short certificate courses on tribal health.
Tribal health. So the students from the city will have an yes, ma'am. Yeah. Thank you, ma'am. Thank you.
I thank all the participants for their valuable participation, their interest for the conference. Thank you so much. Here's an important announcement. Very soon, very soon, our Honorable Chief Minister of Maharashtra, Devendraji Fadnavis, will be joining us. So there are few instructions to maintain the protocol before the dignitaries reach the aims. Because we have got the signal that I would request all to kindly switch off their mobiles or else put it in the silent mode. Please avoid the movements during the program, especially from the front doors of the auditorium. If in any emergency, you are requested to use the rear doors and the rear exits. Please maintain silence during the conduct of the proceedings. Our guests are on their way and we will soon begin with the valedictory event. Participants shall be receiving their certificates at around 6 p.m. after the valedictory event. Also, the prize distribution ceremony will take place after the valedictory, for which the TEER Award, I would say, Tribal Empowerment and Educational Research Awards, for which the paper and poster presentations were conducted. So the prize distribution ceremony will take place after the valedictory function. And in the form of the prizes, we have really something very precious. Can anyone guess? What are the prizes for the winners? Yes, it's the tab. Each winner will get a tab as a prize. Again, I would request all the delegates, all the participants to give their valuable feedback. There are QR codes. There are QR codes displayed on your ID cards. So we still have time. Please scan the QR code and share your feedback. During the valedictory function, we kindly request not to leave your seats or not to leave the auditorium. Please be seated silently. I repeat, kindly switch off your mobile phones or please keep it on the side. Once the chief guest is with us, there are instructions. We shall be closing the front doors. So I would again request kindly restrict the movements in the front zone. I would request the volunteers, please pay attention. Couple of volunteers can come in the front zone near the doors. Both the sides, please. So that you can help us politely restrict the entry from those doors. Honorable Chief Minister of Maharashtra, Shri Devendraji Fadnavis will be joining us soon. FIST 2025, that is First International Symposium on Tribal Health, is going to witness this memorable moment in the grand venue of AIIMS Nagpur with our Honorable Chief Minister, Shri Devendra Ji Fadnavis, very shortly. Kindly switch off the mobile phones, please. Volunteers, please take your position. Immediately after the valedictory function, we shall be conducting the prize distribution ceremony. Can I have one volunteer on the right side of the auditorium, please? Volunteers? Once the Honorable Chief Minister arrives, as a mark of respect, we shall be standing at our places till the Chief Minister is seated. Again, a sincere request. Kindly set your mobile phones on the silent mode. Volunteers, please be alert. Within next 3 to 5 minutes, the Chief Minister shall be arriving in the campus. Dear delegates, please be seated and avoid the movements in the front zone. Those who have not yet given the feedback, we would encourage to scan the QR code provided on the iCard, on your conference card, ID card. Please give the feedback. On the screen also, we have displayed the QR code, as well as on your ID card, there is a QR code. So please do the needful. I could see some delegates standing at the backside. We have lot many vacant seats here. Please take the seat. We have reserved a section for our media and press. So volunteers, please help them be seated.
very good evening to you all. Ladies and gentlemen, our esteemed chief guest, Chief Minister Maharashtra, Shri Devendraji Fadnavis, will be here in any minute. Ladies and gentlemen, please join hands to welcome our Chief Minister, Shri Devendraji Fadnavis. Esteemed personalities on the stage and distinguished audience, I welcome you all for the valedictory function of First International Symposium on Tribal Health, organized by Maharashtra University of Health Sciences, Nashik, in association with All India Institute of Medical Sciences, Nagpur. At the outset, may I now request all to stand to honor our state. We'll be playing Maharashtra Geet.
महाराष्ट्र माझा गरजा महाराष्ट्र माझा जय जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा किती नभा तुझी मुळी कडकडणाऱ्या नभा अस्मानाच्या सुलतानीला जबाब देती जिभा सह्याद्रीचा सिंह गर्जत शिवशंभू राजा दरी दरीतून नाद गुंजला महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा काळ्या छातीवरी कोरली अभ्याची लेणी ओलादी मन घटे खेळती खेळ जीव घेणी दारिद्र्याच्या उन्हात शिजला विठळाच्या घामाने भिजला देश गौरवासाठी झिजला दिल्लीचे ही दत्तराणी महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा जय जय महाराष्ट्र माझा
Thank you. The first International Symposium on Tribal Health, FIST-25, showcased remarkable research fostering meaningful discussions amongst experts for all the 3 days. And as we come to its closing ceremony, it is just perfectly appropriate to have the Chief Minister of Maharashtra Honorable Shri Devendraji Fadnavis with us as our chief guest. May I now request Vice Chancellor MUHS Lieutenant General Madhuri Kanitkar and Executive Director AIMS Nagpur Dr. Prashant Joshi to please felicitate our chief guest Shri Devendraji Fadnavis with memento and bouquet. Thank you, sir. Ladies and gentlemen, the venue of this conference, AIMS Nagpur, has rapidly ascended as a beacon of excellence in medical education and research. May I now invite Dr. Prashant Joshi, Executive Director, AIMS Nagpur, to give his welcome speech.
Good evening, everyone, and respected Honorable Chief Minister of Maharashtra, Devendraji Fadnavis. We are deeply honored and greatly privileged for the time we for your gracious presence. I know your time schedule is so fixed, despite which you could find time to come here for this important valedictory function. These 3 days of FIST conference, rather than a symposium, it is actually a conference attended by 15 international faculty and delegates and faculty all over the country. We had 3 days of extensive discussions, lectures, panel discussions, and a lot of exchange of ideas, and a very productive 3-day workshop, which was very exhaustive. And we come to this end of this 3-day FIST. A few words I cannot hold myself before I speak a few words about our Honorable Chief Minister, Shri Devendraji. We all know that he is an honest and very able administrator. But what I admire most about him is his courage. His courage of going to a Naxalite area in Gadchiroli, traveling in a bus, in a local bus. That is something which no Chief Minister of Maharashtra had done in the past. So that speaks of his courage. Another instance I remember very clearly is during COVID times, when he was afflicted by COVID and was admitted. He did not choose the cozy luxury corporate hospital, but chose to get admitted in a government hospital in a very humble situations. That again speaks of his faith in our system and courage. I've been a great admirer of Devendraji, and we are very blessed that you have come here and blessed us here. We continue to seek your blessings and encouragement. And with the help of your blessings, we hope to achieve to become a premier institute. Started just in 2019, this hospital, and I joined there. That time there was only an OPD started, and had the privilege of seeing the first patient here. Within a short span of 5 years, it is now transformed into a premier medical institution, and with 820-bedded hospital and 80 intensive care beds, which have always occupied, with 45 functional departments, specialty courses going on, and one of the most sought after medical colleges now for the students as well as for patients who want to come here to AIMS. And this has been possible only because we have the blessings of leaders like Devendraji with us, and it is only possible because of this that we could achieve. We are committed to provide affordable and accessible tertiary level care to the poorest of the poor and to the marginalized people so that they get the treatment which the rich usually get in corporate hospitals. So we are always striving in that end, and we have been largely successful till date. We have still a lot of things to be done, and I'm sure we will be able to achieve more greater heights in the coming years. And the theme of this conference, it aligns with our motto also of serving the poor people and also the tribal people. We know we are surrounded by a lot of areas where tribal people are living. We have Gadchiroli, Chandrapur, here Ramtek, a lot of tribal areas. And we have taken off initiatives now to improve the health of the tribal population. We have outreach programs, medical camps. We also have mobile medical units. We also have telemedicine services started. In Gadchiroli, every last month we have collaborating with Search, and also we have already started the telemedicine services. In addition to that, we are already since 1 year we are already providing telemedicine services to Meghat Dharani, where again there is a lot of malnutrition and a lot of high infant mortality. And we are committed to improve and we're also training the trainers there, so that people from there, doctors from there, nursing staff, paramedical staff have come and attended our training courses and have gone back, and they, on a regular basis, on a daily basis rather, they are in contact us through teleconsultation services. So this is our commitment to improve the health of the tribal population, and this was discussed in length in the 3 days symposium which we had, and I'm sure with the help of the discussions we will come out with a policy document which would help we want to actually empower people in the tribal area so that seeking behavior improves. And we want to form a coalition of health professionals, right from governmental, non-governmental, and people who are working in the tribal area, traditional healers, Ayush, Anganwadi workers, and then we have Arogya Mitras. All of them should form a consortium so to improve the health there, because we find many times the highly specialized people are not able to reach that area, but the traditional healers and respecting the local traditions which the tribal people have is also very important, and to align with that and integrate the modern medicine with traditional medicine is something which we are always, and this is a lot of things have been discussed in this 3-day workshop. And we also hope that we come up with an enlightened policy which will again help us in implementing and help us in improving the health of the tribal population. I think with these few words, again, I'd like to express my deep gratitude to our Chief Minister, who has, in his deep, busy schedule, has actually made it here, and I'm very, very thankful for him. Thank you very much.
Thank you very much, sir. Thank you. Under the able guidance of Honorable Vice Chancellor MUHS, now has championed the integration of health education, policy innovation, and public health initiatives. May I now invite Lieutenant General Madhuri Kanitkar ma'am, Honorable Vice Chancellor MUHS, to give her valedictory speech.
Our most respected and cherished, loving Chief Minister, Honorable Devendraji Fadnavis, Dr. Joshi, Dr. Chaudhary, Pro VC Registrar, all the delegates and my dear friends. It is so heartening for an organizer when, any event towards the end, people have generally left. And it's so heartening to see all of you all here glued to your this thing till the end, because I'm sure you all knew that we had this great event where the Honorable Chief Minister himself has taken time to come with us. And let me tell you, for the last 2-3 days, a lot of you all asked me, ma'am, where does your energy come from? But I am nowhere and I have tough competition from sir. He has, I am aware, this morning from Nagpur, been to Bombay, been to, come back, gone to Nanded, come back, attended this, and is ready for the next 2-3 events after that. So that is the energy with which he leads our state, and that is the vision. That is the vision. Sir has an absolute attention to detail in every minute things, has put health and education as a top priority, and under his, the Maharashtra University of Health Sciences, which is our largest state health university, and its regional centers are all getting revived as a center of excellence in a hub and spoke model to revive all the colleges. And we are soon ready to launch that mega project with Asian Development Bank funding, which has been a brainchild and the vision of the Honorable Chief Minister. But this conference itself, like I said, would have been a dream, because a vision is just a dream. But I told you all right on day one, a vision with action changes the world. And I'm extremely lucky to have had a chair professor in Dr. Sanjeev Chaudhary here, who's been a one-man army. I've been calling him that the last 3 days whenever you all have said how perfect everything is. It's because of his dedication and, yes, a real round of applause. That today, Nagpur Regional Center, and we are hoping to get the land soon from the GMC, where we'll come up, and this will be a long-standing association of the grassroots of the Vidarbha region being handled by all our colleges, more than 100 in this region of various pathies coming together, taking down implementation and ground research just like Blossom, and taking it to the referral center of AIMS. We work together. Like I said, it's a celebration of a confluence of collaboration. And I'm sure, as promised you all, there'd be fun at FIST, and I'm sure you all have all really enjoyed the last 3 days, both in the academic feast as well as the gastronomic, because there were excellent breakfast, lunch, and dinner laid out here. Your feedback has been so heartening. Almost a few hundred which were received have already been analyzed. We are fast at that. And 90% of you have loved everything. But like I said, I love the feedback, constructive feedback, where you all have what we want next. So it's always nice to leave when when everyone is asking for more. And we assure you, we are going to come back with a bang. And before I invite and request the Chief Minister, I'd like Dr. Sanjeev Chaudhary to be honored with the Chair Professor's degree and at the hands of our Honorable Chief Minister.
Honorable Chief Minister, the chief guest of this auspicious evening, Vice Chancellor, Lieutenant Maruti Cadet, Executive Director of AIMS, Dr. P.P. Joshi, distinguished guest in the August House, ladies, I am virtually overwhelmed to experience the feelings of this prestigious moment of my life. Ladies and gentlemen, Madam Vice Chancellor has asked me to reply to this felicitation. But let me honestly tell you, ladies and gentlemen, every feeling which you breathe in your heart is not to be expressed. There are some feelings, the expression of which are always beyond words. I said that I am overwhelmed. Yes, indeed, I am overwhelmed. and because of two reasons. One, my selection for this coveted honor has been done by a person who is a symbolic icon of honesty, integrity, and uncompromising approach on merit. And therefore, now I really deserve this honor. Ladies and gentlemen, the second reason is that this biggest honor is being conferred upon me by none else than a person who has become a role model for generations of politicians of this country in a very short period of time. Honorable Devendra ji has been able to distinguish himself amongst the select class of the most able, the most intelligent, and the most popular chief ministers of this country. Respected Madam, as you have conferred upon me this award, with deepest and profound gratitudes and heart full of reverence, I accept this award. Thank you very much.
Thank you, sir. Ladies and gentlemen, we have with us today a visionary leader, a knowledge-driven, people-centric policymaker, and a leader championing social equity and environmental sustainability. Please put your hands together as I invite the Chief Minister of Maharashtra, Shri Devendraji Fadnavis, for his address.
Namaskar and good evening. On the dais, Lieutenant General Madhuri Kanitkar, the Honorable Vice Chancellor of MHUS, Dr. Prashant Joshi, Dr. Milind Nikko, Dr. Sanjeev Chaudhary, man behind the event, Dr. Rajendra Bangal, all the dignitaries of the dais, all the faculty members and delegates who have come from across the world, dear friends, at the very outset, for a country like India, but it is something which is very dear to all those who are active in health space world over, to look into the policy issues of tribal health. And I must tell you that you have chosen the right city to host this symposium. Of course, Dr. Joshi, this is the right place also, but this is the right city because Nagpur is a city which was inhabited by a tribal born king, Bak Buland Shah, 300 years back. And it also symbolizes the great tribal culture, the rich tribal culture which was prevalent in this entire area which was known as Gondwana or the Dandakaranya erstwhile. And I think that it is very right to hold a symposium to deliberate and contemplate on tribal health in the city of Nagpur. And of course, there cannot be better venue than AIMS. So I must also congratulate AIMS for hosting this. And that also gives me pat on the back because I was the one who chose Nagpur to have AIMS. I think apart from this symposium, the tribal village which you have created here is also something which actually reflects tribal customs. It also gives us a glimpse of the nutritional tribal food, tribal customs, tribal art, and also introduces us with the traditional tribal healers. I think this is very good because many times and in many countries, the modern science has thought that it will take over the tribal space and will create a very healthy atmosphere for the tribal population. But it could not happen. It is because when we talk about tribal health, we also must understand the tribal customs, the traditions, the tribal way of life. And we must acknowledge that in today's modern world, it may seem that this way of life is a little backward than what we are living, but we have to acknowledge that for thousands of years, this way of life has been existing, and for hundreds of years it has flourished. And when we see world over, many civilizations are extinct. They are just part of history. The tribal civilization is still there. The tribal culture is still prevailing. It's still alive. And that is why when we think of providing health solutions, we must take into account these traditions, these customs, and of course, tribal healers who are the first responders when it comes to many types of ailments. Only the confluence of modern medicine and the age-old practices can create an environment where we'll be able to provide proper health care to our tribal population. And I think when you called the tribal healers here, that shows that you want to create this synergy, you're trying to create this synergy, and I think that is the most important thing which we need to do. Today we know that there are many health issues prevailing in the tribal area. Most of the issues are related to malnourishment. A malnourished mother gives birth to a malnourished child, and everything starts. We know that anemia is more prevalent in Indian women. But when it comes to the tribal women, around 65% of the tribal women are anemic. And I think these are certain things on which we need to work. I think the policies of government have been aligned with all these problems. And I'm happy that in every survey, National Family Health Survey, we see improved indicators, but still there is a huge gap. Still, the indicators which we find in non-tribal population and those we find in the tribal population, there is a huge gap which we need to bridge. But having said that, so far as malnourishment is concerned, for providing nutrition, now many schemes have been rolled out by the government, and those schemes have actually shown the results. We can see lot of improvements in state like Maharashtra. We can see that the mortality rate, mother's mortality rate, they have significantly gone down. But I think if we can actually create the synergy in providing nutrition to all these mothers and the children using tribal customs, wherein lot of nutritional food was available and it had nutritional value to actually help the newborn mother, the child. I think due to certain customs, due to certain prevailing conditions, this age-old knowledge is not properly passed. And I think if we can have somebody working towards that, a group of people can work towards that and find out solution nutrition from the local produce, from the local products, it will be easier for us to provide nourishment to the tribal population. I think if you look at various problems, especially the sickle cell is a disease which is most prevalent amongst our tribal population. I'm happy that AIMS has started a center of excellence in sickle cell. Our Honorable Prime Minister has started a movement to make India sickle cell free. We have started genome sequencing in this area, and I'm sure that the Center of Excellence and people who are working in this arena will find out new solutions to stop and eradicate this disease, which is not only killing our tribal population, but I think its treatment is also very costly, unaffordable, and I'm sure that will make it affordable and accessible because of this Center of Excellence and because of such brainstorming symposiums which would bring out solutions into such problems. I think there are many issues. Some issues are very minor. They look minor, but they are bigger. There are many tribal districts where people die because of malaria. And we are trying to fight with malaria in district like Gadchiroli, where a simple intervention of providing bed nets have allowed us to keep away people from having malaria. I'm very happy that now we are rolling out a program with a cost of 25 crore, where Gates Foundation, ICMR, and Foundation have come together to fight with the disease of malaria and to make these districts, especially in Maharashtra, a district like Gadchiroli, malaria free. I think now is a time where all of us know what is detrimental to the tribal health. We know the causes, we know the effects, we know the solutions, but we need to connect those solutions to the tribal population. All of us know that most of the tribal population is living in far-flung areas, in difficult areas. There are livelihood problems. For livelihood, they are traveling for at least 4 to 5 months. So I think this entire issue is connected issue. It is not just health issue. It is an issue which is multidimensional. If you look at it from only health perspective, you will fail somewhere. It has to be in a multidimensional way, where the customs, the traditions, the livelihood, and of course, the health, everything needs to be looked at simultaneously. And I think that's where a policy framework is needed to. I'm sure that with such deliberations, we get good inputs to create a policy. And I was not present here for the entire symposium, but I'm sure that those papers which presented here, those thoughts which were put together towards improving the tribal health must have been put together, and the organizing committee will come out with a composite paper on all these deliberations. And I'm sure that the next step will be the formulation of policy, since MHUS is a public university, AIMS is also a public institution. I would like to offer all the support from other departments of the government towards creating a comprehensive policy towards tribal health. Let us decide that the outcome of this symposium is creation of a comprehensive policy which is not only useful to the state of Maharashtra or to the country like India, but it also is followed by other countries as well who are participating. And I'm sure together we can change the scenario of tribal health. And I must thank you for organizing this first International Tribal Health Symposium. As all of us know, this beginning, and I'm sure that this beginning will lead to something that will make a real change. Congratulations and thank you for having me here. Jai Hind.
Thank you, sir, for your encouraging words and guidance, especially to manage the problems which are associated with malnutrition. And thank you, sir, for sparing your valuable time for this event. Now I call upon Shri Sandeep Rathod, Deputy Registrar, MUHS, to give his vote of thanks.
Thank you, Dr. Darshan, sir. Good evening, one and all. It's an honor and a privilege for me to propose a vote of thanks in front of such a august gathering on and off the dais. At the outset, on behalf of organizing team FIST-25, I express deep sense of gratitude towards the most promising leader of the state, Honorable Chief Minister Sri Devendra Fadnavis, sir. Thank you very much, sir, for sparing your valuable time and your words of wisdom, sir. The Visionary Vice Chancellor and our own MHS Supremo, Lieutenant General Dr. Madhul Kanitkar, Madam. Madam has given each and every second to this symposium right from the initial stage. It is the brainwave of Honorable Ma'am. Thank you very much, Honorable Ma'am, for showing us the way how the symposium execution should be. Thank you very much. I propose a sincere sense of gratitude to Director and CEO AIMS, Darshan Joshi, sir, for the collaborative support. The central and state MOU within a 6 month of time, and the output is before you all. So thank you very much, sir, and the team AIMS Nagpur. Honorable Pro Vice Chancellor Dr. Milind Nikum, sir, a pillar of strength to this event. Our dynamic administrator, Dr. Rajendra Bangal, sir, and team MUHS for showing all the management and administration over here. I know the one name you all are eager to hear. The one man army and the soul of the symposium who has given his entire time and month. We all know the organization of such event doesn't happen in one overnight. It takes time and efforts and management. So, ladies and gentlemen, I sincerely express the deep sense of gratitude to our own chair professor, Dr. Sanjeev Chaudhary, sir. Honorable sir, this total symposium and RC Nagpur is quite inevitable to all your efforts, sir. Mr. Kiran Taulare and our Dr. Bosle, sir, they are equally supported and played a role as a catalyst for this particular event. The most importantly, all the delegates came from the globe across, the speakers, those who have contributed, the academician, those who have contributed. So our deep sense of gratitude towards you all. I also want to mention about Dr. Manisha Kothekar, madam. She added a glory and life to the tribal village with the help of Dr. Mohan Inde, sir. So thank you very much, Manisha, madam. I also want to express the deep sense of gratitude towards the chairman GPSC, Dr. Uday Singh Raurani, sir. All the way he has came here and contributed this symposium. Thank you very much, sir. I am gratified and tell you all, the organizing committees and AIMS and MUHS has shown this better performance before you all last days. Most importantly, the sponsors for this event, we are very much fortunate to have the contribution at the guidance of Chair Professor, our MLC Honorable Dr. Parinev Fuke, sir, Sri Abhijit Vanjari, sir, Honorable MLC Bhavna Gauli, madam, Honorable MLC Krupal Tumane, sir, the Solar Industries, the Pagaria Group, the Pharmacon, Mahagenco, Coal India, Viswaraj. There are many more to the list. So I am giving sense of gratitude towards all the sponsors and above all the rock stars, the volunteers. These volunteers have made you are all the comfortable stay here. So one clap to unke liye zarur banta hai. So all the support staff from MUHS and AIMS, they need a special recognition. The take team, the press, media, and each and every individual who have partly, impartedly supported this event. the outcome policy and the people from the law university, those are making the policy document. I also express a deep sense of gratitude towards them. And I want to end up my vote of thanks by saying, मुद्दतें बीती है किस्मतें आजमाने के लिए, क्या कुछ नहीं लगता एक मकाम पाने के लिए, आज हमारे बीते हुए कल से पूछिए कितने रोए हैं हम आज मुस्कुराने के लिए.
Thank you, sir. I request all the paper and poster presenters to please be seated in the auditorium after this program. At the end of this program, now I request you all to please rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चय जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मागे गाहे तब जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
We will be starting with the with the prize distribution program. All the participants for oral and paper presentation, for poster and oral papers, please be seated. All the delegates, please be seated. Certificate distribution will start soon.
Let's have the awards before everyone.
Please be seated for the prize distribution ceremony for Tir 25. So we shall be starting with the poster presentation awards. The poster presentation from serial number 1 to 25. The second prize for the poster goes to Dr. Mita Gharte. Mita Gharte. Please come up on the stage. Dr. Mita. Is she there? Yeah. Please give her a big round of applause. Second prize poster in the category of 1 to 25. Ali, yes, please. Poster from serial number 125, first prize goes to Swanand Shukla. If they're not there, let us know. Yes, please come up. For the poster from serial number 26 to 50, second prize goes to Roger Akafu. Roger Bokeh Akafu. Is he there? The first prize poster, serial number 26 to 50, goes to Dr. A.D.I. Dr. A.D.I. Now the second category, paper presentation. Hall A. Dr. A.D. Amte, there? Yes, please come. Roger Akafu. Who? Okay, on behalf of Dr. Roger, Dr. Asha will be receiving the certificate and she only presented. Okay, ma'am. For paper presentation, Hall A, second prize, Dr. Nilesh Ingre. Yes, there? Paper presentation, Hall A, first prize, Dr. Kalai Selvi Selvaraj. Dr. Kalai Selvi Selvaraj. Paper presentation, Hall B, second prize, Dr. Sachin Khatri. Paper presentation, Hall B, first prize goes to Dr. Jaya Prasad Tripathi. Dr. Sachin Khatri from GDC Nagpur. Dr. Jaya Prasad Tripathi. Is he there? Dr. Jaya Prasad Tripathi from AIMS Nagpur. First prize. How many remaining? Hall C, paper presentation, second prize. The awardee is Dr. Abhijit Bharadwaj. Hall C, first prize, paper presentation, Dr. Vaibhav Dani. Hall D, all papers. The second prize for Hall D goes to, let them come now. No. Second prize, Hall D, Dr. Vedahi Kade. Vedahi, is she there? Dr. Vedahi? Yes. Hall D, first prize. And the last winner of the award session that I'll be announcing, the first prize, Hall D. Any guesses? Dr. Amit Kumar. Dr. Amit Kumar. Dr. Amit Kumar, Hall D, first prize. Congrats. Then this one. That. Oh. Done? Done? Dr. Amit Kumar, first prize, Hall D from AIMS Nagpur. We congratulate all the winners for receiving a wonderful prize. Prize is the tab. Lovely. Thank you. I would invite Dr. Rajeshri Khoth, Additional Professor, Department of General Medicine, AIMS Nagpur. She would like to announce a special thing. Ma'am, please.
Thanks a lot. Actually, I wanted to come here to give feedback also, but the time is very short. I won't take much of your time, but I'm here standing before you for two reasons. One is on behalf of AIMS, our executive director, and all my team, members in the organizing team, my volunteers, I would like to express a heartfelt gratitude to VC Madam for giving us this opportunity to host this wonderful conference with a unique theme. Thank you so much, madam. And the second, and it is also a very, very important reason, is that this conference was being planned 1 year in advance, but we came into picture when AIMS Nagpur was selected as a venue for this conference. And since then, we have been, and I was honored to be the joint secretary. Meenakshi madam was the co-chairman. So we have also been working hard to make this conference a success, and everyone should appreciate the venue so that such conferences take place at this venue again and again. So, and for this, madam, there is no seniority, juniority, or hierarchy in whatever we are doing now, but we would like to express our heartfelt gratitude towards again the person who was a one-man army, and that is Dr. Sanjeev Chaudhary. I request Dr. Joshi sir to hand over our AIMS memento to Dr. Sanjeev Chaudhary. And please give him a big round of applause and a standing ovation. Dr. Sanjeev Chaudhary sir, we are so thankful to you for giving us this opportunity. And I would like to place on record the calmness and coolness with which you organized everything. And it was a great pleasure working with him and to see how he arranged everything. And we used to feel so sorry that he's arranging visa for the travelers. He's making their traveler arrangement and everything. And we are asking him, sir, how many rooms you want in the hostel? How many volunteers you want? So, sir, it's been a pleasure working you. The second person whom we troubled a lot and who also, you must have seen him, a person who was just running like as if he's running a marathon. And we would like to honor Dr. Kiran Tavlare. I request Dr. Joshi sir to present him our AIMS memento. Dr. Kiran Tavlare sir. Yes, there he is, sir. दौड़ के आना था जैसे आप दौड़ रहे हो. I think he's too tired. Take some energy from VC madam. So he was on phone day in, day out, and he did every menial job. So thank you so much. No. And the third person who was, we would have liked to honor Dr. Gode sir also, he is not there. But third person who also planned everything at the last moment and us, and we would like to honor Dr. Rathod sir, Deputy Registrar of MUHS, with our AIMS memento. And he inspired us by wearing shirts with Varli prints on it. So I think everyone would be wearing those types of shirts in the next conference. So thank you, sir. So on behalf of all AIMS family, we have honored them and we have taken inspiration for them. And I would also like to thank our MOCs here, Dr. Neelam, who has conducted the proceedings so well, and Dr. Darshan Dakshindas. MOCs are always forgotten. So we would like to thank them from the bottom of our heart.
Thank you so much. As ma'am said, AIMS family, I'm also a part of that family. I'm Dr. Neelam Bajaj, Associate Professor, Department of Dentistry, AIMS Nagpur, and also the student of MUHS. My graduation and post-graduation is from MUHS University. So I think, ma'am, I had justified my role sincerely. Thank you, audience.
And thanks a lot, everybody. Remember this conference for everything it has given you, and we hope to see you next. Thank you. Thank you very much. Thank you, ma'am. Thank you, sir. And thank you, everyone whom I may have inadvertently forgotten, but thanks a lot.
Thank you all. Kindly collect your participation certificates. And again, I would repeat the same announcement. Please scan the QR code for the feedback.